Assalamualaikum warahmatullahi wabarakatuh and a very good morning to everyone watching our live stream. Welcome to Sports Injuries and Athletic Stress webinar. We are very happy and excited to have you here. We will start in a few minutes, so sit back and relax while we wait for our guests to arrive. Honored guest, Association Prof. Dr. Tengku Fadilah Tengku Kamaldin, Head of Sports Studies Department, Faculty of Educational Studies, University Putra Malaysia. Mr. Wan Zaharuddin Wan Abdullah, Representative of Co-Curriculum and Student Development Center, University Putra Malaysia. Speakers and panelists, Dr. Johan Abdul Kahar, Dr. Rosanna Dev Omar Dev, and Ms. Zilin. Organizing Committee, participants and all members of the floor. Assalamualaikum warahmatullahi wabarakatuh and welcome to webinar Sports Injuries and Athletic Stress. To start our opening ceremony and bless today's webinar, I would like to invite Mr. Muhammad Amjad Wafi bin Shamsu Hazli to recite the dua. Please welcome.
Bismillahirrahmanirrahim. Al-Fatihah. Bismillahirrahmanirrahim. Alhamdulillahirabbil alamin. Wassalatu wassalamu ala asyrafil mursalin wa ala alihi wa sahbihi ajmain. Allahumma innaka khallaqul azim, innaka samiun alim, innaka ghafurur rahim, innaka rabbul arsyil azim. Ya Allah, Engkaulah yang mempunyai segala kepujian Engkaulah yang berhak menerima segala kepujian. Engkaulah yang berhak menerima segala kesyukuran. Engkaulah yang memiliki segala pemerintahan. Di tangan Engkau segala kebajikan. Kepada Engkaulah kembali segala urusan. Allahumma ya karimu ya rahim. Limpahkanlah rahmatmu dan rahimmu ke atas majlis yang akan diadakan pada hari ini. Berkatilah majlis ini dari awal hingga akhirnya. Kami juga memohon perlindungan daripadamu dari segala perkara yang boleh mencacat celakan majlis kami dan daripada segala perkara yang melalaikan kami dari berbuat taat kepadamu. Kepadamu jua kami serah segala urusan kami. Rabbana atina fid dunya hasanah wa fil akhirati hasanah wa qina azabannar. Wa sallallahu ala sayidina Muhammad wa ala alihi wa sahbihi wasallam. Walhamdulillahi rabbil alamin.
Thank you, Amjad Wafi, for the recitation of the dua just now. Next, I would like to invite the Deputy Director of this program, Mr. Ahmad Haris Shahmi bin Husairi, to give his speech. Please welcome.
Thank you, MC. Assalamualaikum and good morning to our honored guests, Associate Professor Dr. Tengku Fadila Tengku Kamaldin, Head of Sports Studies Department, Faculty of Educational Studies, UPM, and Mr. Wan Zahrudin Wan Abdullah, Representative of Co-Curriculum and Student Development Center, UPM. Facilitator Program Advisor Mr. Alias Abdul Aziz, speakers and panelists Dr. Johan bin Kaha, Dr. Rosanna Def Omar Def, and Zilin Lee Ying Hoi, organizing committee, and all members and participants of the floor. First and foremost, let us be grateful for being given the opportunity to be here today in order to virtually attend the Sport Injuries and Athletic Stress webinar. I would like to welcome and thank our guests and panelists. It is an honor to have such amazing figures that I'm sure many looks up to in this webinar. Ladies and gentlemen, today's program is to give more exposure about sport injuries and athletic stress, which both are rarely talked about, although it is a common thing to experience as an athlete. Today, we will have specialists and also a national athlete that will share their knowledge and experience, which is going to be useful to all of us. Spinal cord injury, shin splints, and ankle injuries are common among sport injuries. A career ending injury does not necessarily mean physical injury. It is often seen that players withdraw from competitions due to mental health too. For instance, last year Simone Biles, an American artistic gymnast, withdrew from the 2021 Olympics to focus on her mental health. Ladies and gentlemen, for your information, this program is organized by QKS 2120 Volleyball Group 1, which all of the 35 members and one facilitator have been involved in order to make this program successful. Before I end my speech, I would like to use this opportunity to thank all of you who are involved in this program directly or indirectly in providing cooperation and contributing their ideas and energy for making this program to happen. I hope that all of you will enjoy and gain useful knowledge throughout this program. That is all from me. Thank you. Assalamualaikum warahmatullahi wabarakatuh.
Thank you, Mr. Ahmad Haris Shahmi bin Husairi, for the meaningful speech. We know that you and your team have worked hard to make this program a success and to spread awareness about sports injuries and athletic stress. Next, I would like to invite the representative of Co-Curriculum and Student Development Center, Mr. Wan Zahrudin Wan Abdullah, to deliver the welcoming speech. Please welcome.
Thank you, Mr. Chairperson. Honored guest, Associate Professor Dr. Tengku Fadilah Tengku Kamaldin, Head of Sports Studies Department, Faculty of Educational Studies, UPM. Speakers, Dr. Johan Abdul Kahar, Dr. Rosanna Dev Omar Dev, and Ms. Azilin. Organizing committees, participants, and all members of the floor. Assalamualaikum and good morning to all. Thank you for inviting me and welcome to this momentous program, webinar Sports Injury and Athletic Stress. Before I start, let me grab this opportunity to thank the organization committee in successful preparing and handling this event. So headed by Mr. Alias Abdul Aziz, the facilitator and advisor for this program, and credited curriculum course Volleyball QKS 2120 Group 1 UPM. I would also like to thank our honest guest, Associate Professor Dr. Tengku Fadila Tunku Kamadin, speakers and panelists, and all participants for participating in today's webinar and show your support and share your valuable time in our here today. Thank you very much and welcome. I'm here to give the welcome speech on behalf of our Associate Professor Dr. Azura Uzain, the Director of Curriculum and Student Development Center, UC Putra Malaysia. Ladies and gentlemen, this program is a community program held by students of Credit Curriculum course, University Putra Malaysia, monitor and lead by Facilitator of Curriculum and Student Development Center. One of the main objectives of curriculum studies UPN is to design and implement program that will shape and develop the character of the student in line with the vision and mission of University Putra Malaysia, which is to produce balanced graduates in academic assessment as well as in curriculum in co-curriculum. Specifically, the objective of this course are to enhance students' effective communication skill, encourage student critical thinking, creative, innovative, and analytical thinking, promote student teamwork and independent skill, increase student professional and moral standard in social interaction, and lastly, strengthen student leadership skill and lifelong learning through organizing program like one that we are right now. When you stop learning, you stop growing. Since the pandemic has come to strike the community as global skill, we have to still keep learning despite many challenges, teaching and delivering the best we could and adapt ourselves in this new normal via digitalization and online learning so that we are not left behind in the academics and knowledge gain. In a nutshell, this webinar will expose you to sport injury and the effect of stress towards athlete fitness, performance, and achievement. I hope that this webinar would be an eye-opener to us all in the importance of sports safety and mental health, especially to the athlete for a better performance and hence greater achievement. I also hope that you would gain as much knowledge as you could from our experienced and credible speakers and panelists. Without taking much of your time, I once again would like to thank everyone for being here and welcome to webinar Sports Injury and Athletic Stress. Wabillahi taufiq wa hidayah. Assalamualaikum warahmatullahi wabarakatuh. Thank you.
Thank you, Mr. Wan Zaharuddin Wan Abdullah, for the speech. Last but not least, to officiate the ceremony, I would like to invite the Head of Sports Studies Department, Faculty of Educational Studies, University Putra Malaysia, Associate Prof. Dr. Tengku Fadilah Tengku Kamaldin to deliver the officiating speech. Please welcome.
Thank you so much. Bismillahirrahmanirrahim. Assalamualaikum warahmatullahi taala wabarakatuh. And a very good morning to everyone. Respected Representative Co-Curriculum and Student Development Center, my respected friend, long-time friend, Mr. Wan Zaharuddin and Wan Abdullah. Very nice to hear you speech, talking in English in the morning. Program Director Chai Jayi, and speakers and the panelists, I'm not so sure whether they are here. Dr. Johan Abdul Kahar, Dr. Rosanna Dave, Umar Dave, and we have Ms. Stephanie Gunn, Huawei, fellow organizing committees and participants and all the members of the floors. I'm very pleased that you invited me today. I'm very pleasantly surprised that Chai called me in the 2 days ago for me to officiate this event. It's my pleasure to be here today to officiate the webinar for the sports injuries and the athletic stress, organized by the Volleyball Group 1 for the course QKS 2120. Yeah, and I was made to understand that this is a collaborative effort with the Hospital Pengajar UPM as well as the Faculty of Educational Studies. So I'm very honored to be here to give this opening speech. Thank you for inviting me. The issue about sports injury and athletic stress is very much a popular topic among athletes. Yeah, and it is very nice that actually the volleyball group chose this particular topic, because volleyball is one of the highest the sports that has highest occurrence of injuries due to the nature of the sport, where they actually had to jump and then they have to land. If you don't have the right skills, you will most probably or not will end up with injuries. So hence it's not uncommon to see volleyball players with straps, either from the wrist, and it's usually the ankles. Yeah, and this happens from amateur until the very elite athletes. Yeah, elite athletes. You can see the injury not only happen, but it is occurring repeatedly. So this webinar is really very timely, especially for the group on volleyball. Yeah, volleyball. And especially now that the university is preparing for Masum, and we will be having SEA Games. So for those who are involved in this particular group and those members of the floor, I believe that today will be very beneficial for you. I like to congratulate as well, yeah, the team, because they have found, they have uh, managed to successfully included Dr. Johan Kaha. Dr. Johan Kaha is a sports surgeon on shoulders and knees, and from Hospital Pengajar, so our own expertise. I believe he will be speaking a lot about he will be sharing his experiences. And we have also Dr. Roxana Dave. Roxana Dave is a colleague of mine, and she is a accredited fitness trainer from um, United States, and she herself have experiences in injuries, and she's currently teaching sports psychology at undergraduate and postgraduate level. Hence, she is really suitable to speak about the mental state of someone who has injuries and someone who is recovering. Mind you, an athlete who is injured, after years and years of training, it only takes around about 2 weeks for everything to deteriorate the muscles, and it's very depressing for an athlete, especially when they are gearing towards competitions, to be facing an injury at the very last moment. Okay, I do not want to go too much, but I believe we also have someone who is also going to be speaking from experience, Miss Stephanie, who is our national athlete, and the three of them will be sharing their knowledge and expertise and their experiences, yeah, with all of us today. And it is very aptly in line with our tag, with knowledge we share. So before I end this speech, I like to express my utmost appreciation and gratitude to the organizing committee for inviting me to this opening ceremony. I sincerely hope that more impactful programs like this will be held for the future. And without further ado, in the name of Allah and the phrase Bismillahirrahmanirrahim, I hereby officiate this program of this webinar titled Sports Injuries and Athletic Stress. Wabillahi taufiq wal hidayah. Wassalamualaikum warahmatullahi ta'ala wabarakatuh. Thank you very much.
Thank you, Doctor, for the wonderful speech and willingness to spend time to officiate our webinar today. We are honored to have you here. Thank you once again. Before we start with our main event, we would like to share a short introduction video regarding today's webinar. With the video ended, now we have come to the end of our opening ceremony. I, on behalf of all the organizing committee, once again would like to thank our honored guests, Associate Prof. Dr. Tengku Fadilah Tengku Kamaldin and Mr. Wan Zaharuddin Wan Abdullah for the speeches, and we look forward to having you again in the future programs. Thank you very much. Before we proceed, I would like to give some reminders to all participants. We hope that all participants will stay put until the end of the program because the link of your attendance and feedback form will be given out at any time. To University Putra Malaysia students, your merit will be keyed in manually from the attendance form. So make sure you stay with us throughout the program. If you have any questions to our speakers and panelists, please leave the questions in the comment section. Thank you for your cooperation. Now, we have come to the moment that we all have been waiting for. To begin with our webinar, it is my great pleasure and honor to invite our first speaker, Dr. Johan bin Abdul Kahar, to share his experience and knowledge with us on the topic of sport injuries. Dr. Johan Abdul Kahar is specialized in orthopedic surgery. He obtained his Bachelor of Medicine, Bachelor of Surgery, and Bachelor of Obstetrics from Penang Medical School. I'm sorry, from Penang Medical College in 2009 and later obtained his Master of Surgery in Orthopedics from University Putra Malaysia in 2019. He currently works as an orthopedic surgeon in Hospital Pengajar University Putra Malaysia. Without further ado, please welcome Dr. Johan Abdul Kahar.
All right. Assalamualaikum and good morning. I hope everybody can hear me loud and clear. So my name is Johan. Today I'm going to present regarding the sports injury. Thank you, Nafa, for the kind introduction, and thank you to the organizing committee as well for inviting me. I will proceed to share my screen, if you guys don't mind.
Yeah, Doctor.
All right, can you guys confirm that you can see this slide, this full screen? Okay, I'll be talking throughout the lecture, but if there is a moment where it is not clear, do interrupt me and let me know, all right? So, my name is Johan. I am from the Orthopedic Department, Fakulti Perubatan and Sains Kesihatan UPM. And basically, this is the outline of my lecture today. Mainly, I'm going to focus on letting everybody know about the common injuries that is sustained and in pertaining to volleyball especially. Yeah. Greetings from the hospital Pengajar UPM. To those who don't know, our university have our own teaching hospital operating since 2019 and slowly growing in terms of service. This is the layout of my department, orthopedic, and it is a mix between both what they call academic as well as the service side from the HP UPM as well. So we work together as a team, and there are 8 subspecialties where all of them are orthopedic, but of course there are subspecialty like hand, sports like us, foot, ankle, arthroplasty, spine, and so on. In particular to sport, it is headed by our mentor, Professor Madya Dr. Muhammad Nizlan. And then also another sport surgeon is Mr. Raymond, all right? And this is me. We are working in combination with the service guys from the HP UPM. So our specialist, Mr. Azlan, our MO, and also our MA Rosli. So bila cakap when we talk about regarding surgery, we do operations lah, and when it comes to sport related surgery, we do operation in terms of arthroscopy, especially arthroscopy meaning like a keyhole surgery into the joints. And mainly we operate on knees and shoulder. But not just operation, of course, we also manage patients in clinic. This is our clinic in Hospital Pengajar if you happen to drop by. And this is our ward and our clinic room, not in action lah. This is when they are being opened. Now, I like the topic about sports injuries because it is quite close to my heart, all right? One thing about sports injury is important for everybody to know is because it is very common. It is very common because as our society grow and as we are moving towards a more developed society, more and more of us are participating in casual or rather in sports as a favorite pastime. It is not odd to hear people going for futsal game at night or running marathon at 12. Maybe 20, 30 years ago, this is considered crazy, but nowadays it's normal. And then people going to gym, very normal. And it is a good environment, or rather a good thing to hear that people are participating in this sport. Even maybe you guys are aware about this viral video down here where people brought their bicycle because it's very expensive bicycle. People spend 10,000 thousands of ringgit on nice bicycles because of want to participate in sport, and that is a good thing. But naturally, when more people are participating in sports, more injuries will come, and they will come to us also because they need to seek treatment on serious injuries. And the thing about injuries, most of us probably have sustained some kind of sports injuries at some point of our life, right? So maybe the thing is not so serious, okay lah. But problem is some injuries can be devastating. For athletes, sometimes can be career ending, and even for non-athletes, it can have a long-term effect. Maybe after I don't know if you guys can recognize this football player, Liverpool football player, Jibril Cisse during my time lah, kan. After he fractured his tibia in a game, after that, fractured tibia, okay, but his performance is never the same. He used to score so many goals. After that, can still score goal, but maybe not as many. Impact on the performance. And for athlete, it is a problem lah, because this is what professional athletes live for. This is their interest. This is what they're good at. One injury can have a devastating effect on that, right? And even as a non-athlete also, it will have effect on our daily work. We have chronic pain ke, disability ke, anything that will affect our daily work. Susah nak cari makan, and our daily activity with family, it will impact us. And it's good that today there is a covering about the stress, which I'm sure will cover about the mental stress and mental well-being. Yes, injury does have a big impact on that. People come with feeling depressed because of cannot do certain things. See the other friends go and play, like Squidward seeing this SpongeBob and his friend go play futsal, and then you can only watch from the side. So it's very sad. And then not to mention, of course, about the financial burden on the society, where there's a loss of working punya force, there's loss of function of certain individual, and of course the treatment costs for those who are injured. And it is very close to my heart also, because I also was a victim of sports injuries about 15 years ago when I was a medical student. Got injured in a friendly football match, and then I tore my ACL, anterior cruciate ligament. And here you can see that my friend is messing around with me by playing with my crutches. So and then I need to undergo surgery, and then I need to go to the teaching in the ward. Weeks after the surgery, not fully recovered, I have to use a wheelchair. And here I am after being injured, have to sit at the sideline to watch the football match, because you can't play, and then you have to sit and watch what to do lah, and we can't enjoy the football as much anymore. Even when you recovered later on, that's a different story. So you may see me smile here, but it is actually inside the heart, it's very painful. Right, moving on to volleyball. So realizing the importance of the injury, you need to understand, since you guys are participating in volleyball, where is the place that you usually got the injury? So although relatively low incidence compared to other contact sports like rugby ke, or kalau in American punya literature, they say American football, or of course, one of the most popular sport in the world is the football, or American call it soccer, we call it football lah. So compared to all those, it is still lower. But just now, as we have heard, it is still a significant event. And as you know, one injury too many sometimes, if it happens to a key player of the team. So you need to understand that the most injury will occur in this zone, in this red zone that I have highlighted. Is called the net zone. I'm not sure is it the correct term for in volleyball language, but in literature they call it the net zone. 65% of injuries will happen there. In general, injuries can be divided into acute or overuse kind of injury. Acute meaning before that perfectly okay, normal, something impact happened during the game, and then injured. Normally it's like that. 75% of injuries are like that, but 25% more are about overuse of injury. After you play, maybe you feel a bit of pain, okay, and then you relax a bit. Next game you play, painful some more, and then relax a bit, goes away, and then after that happen, and then worse and worse over time. Overuse kind of injury. And true enough, as mentioned just now, memang the ankle sprain is the commonest. Ankle region is the commonest part to be affected, especially in acute type of injury. 20% of them lebih kurang. Literature will give you a variable number, of course, naturally, but it's around there. And it's also usually associated with blocking and spiking activity. And overuse will usually affect the knees and shoulder, but you know, these injuries or regions can occur anywhere. The good thing is it may be preventable, all right? So we try our best to try to prevent the injuries. Now, a bit of a, what do you call, maybe you can call it controversy lah. How common or certain injuries are sometimes maybe a bit difficult to interpret because the definition of the injury. We know that we ourselves also have experienced some kind of light so-called injury when we play sports, and then we don't go and seek treatment pun. And usually when it is defined as injury in the literature, they will define it as an event where the athlete or the affected person presents to the medical punya help or medical treatment for the injury. So sometimes we have some light sprain apa, we don't go seek treatment. So injuries punya incidents may be underreported, especially the so-called mild ones. There are arguments about male versus female, whether incidence is higher or not. Yes, for example, like overuse injury, apparently it is more prevalent in male, especially the non-elite or non-athlete ones, all right, the casual ones. Whereas acute injuries usually happens in young females. But overall incidents are about the same. You can't really say whether you yourself are at risk of certain particular injuries only. Yeah. Yes, argument whether related between athlete versus casual player or so-called weekend warriors. All right, we know that if you are athlete, you are more well conditioned, you have better muscular strength, you have better coordination, joint sense, and all that. And then that's why the so-called casual or weekend warriors tend to get injured easily. All right, but having said that, you must remember also athlete also participate more in a more competitive manner. So they may, in the end, have similar risk of injury in the end. And some arguable predisposing factors. There are people who say maybe the height is a factor. The more height you are, the taller you are, the more predisposed you are to injury. Hyperlaxity of the joints, possible also. And then weight. Usually weight is quite clearly predisposing factors, but otherwise it's about the same. So if you just try to search for common region of injury, they will show you something like this diagram, and they will have variable numbers, and it's okay. But in conclusion, I would say the lower limb usually is more affected in literature. And when you say lower limb, especially the ankle and the knee. For the upper limb, it is the shoulder. So usually these are the parts involved. But I'm sure you have seen other places, right? Head and face is possible also. Ball come from a ball being spiked, come straight to the face and cause some bleeding. Possible. You might think it is light injury, but don't presume. It is possible. And other places as well. Even spine. When I look for literature, then I realize, actually, yeah, it is possible with the level of activity that is expected from volleyball players. Right, so as mentioned, these are the common regions that are affected. I hope so far so good. Everybody can follow and it is clear, yeah? Can be acute or overuse injury, as I mentioned, and it is not like mutually exclusive kind of thing. Acute injuries will lead, or rather may lead to a chronic or recurrent. So be careful in terms of recognizing the injury as well as knowing when to stop or hold back. Ankle. Now, usually, according to literature, it is usually because of landing on other people's feet, either teammates' feet or opponents' feet on the other side of the net. Something that I also just realized when looking through literature and also videos of people playing volleyball. Never realized that actually before this. And not just landing on feet. If you're awkwardly landing on on a hard floor on your own also, you can also sprain. And logically, it is usually this kind of sprain, inwards inversion kind of ankle sprain, and possible injured structures are usually ligaments, and most of the time it is ligaments. The one that is labeled here, the red ones, the so-called torn ones, yes, these are the possible ligaments that might be torn, okay? And then cartilage are the smooth ends between the joints, where the joints articulate smoothly, they can get injured, and then last but not least, of course, the bone itself, which can cause fractures, right? And its variable severity. Many of us experience ankle sprain before, right? And we think, okay. But not all ankle sprains are the same. Some of them can be severe, can have combination of injuries here, and can have prolonged effect. That's why if you have ankle sprain, don't just assume that it is okay. It's not the same. And it can happen again. Injured sekali, dah rasa dah baik, and then injured again, then problem. I'm just going to play this video. I hope you guys can see this video that is being played. So these are a few injury. Focus on the guy on the right with the black shoes. When he jumped to block, I think, and then when he landed, it's a forced inversion of the ankle, and naturally it will be immediate pain. This one not quite sure how he landed, but most likely it is because of ankle injury as well. So if you just Google it or you YouTube it, you will see a lot of example of ankle related and knee related injuries. Mainly is usually is lower limb, and because it's more dramatic, they will show you wounds on the faces as well, although it's not that common. You see how this lady hurt her ankle. She's the one on the left with the black socks. See, she landed on the opponent's feet. I'm not sure if in terms of rules, from what I understood, it is if the whole shoe is not over the line, it's still okay lah. But it's still having problem with her landing, and she hurt her ankle. You can also have another view after this from the back. See. Imagine the whole body weight is forcing on the ankle and it's being inverted like that. So yeah, it is a big problem. This is probably how it will look like after it is being sprained, immediately being sprained. I've experienced this once also on my right ankle, become gemuk like that. Because apa? Because the ligaments inside are injured, and usually it is the outer side. This is the right ankle view from the outer side. And usually these flimsy ligaments that will get torn, usually it is the anterior talofibular ligament, ATFL. And if it is torn completely or is very loose, then we may have to operate to reconstruct it. All right. But most of the time, they just sprain, like what we are experiencing. Most of the time, it will be okay with conservative management, okay, as long as you comply to the rehabilitation. This one is on the inner side, deltoid ligament. Deltoid ligament very, very, very hard, very tough. Usually it won't tear. If you were to put force on it, usually it will break the bone first. It will fracture first. Sometimes you can have syndesmotic ligament. This ligament is situated somewhere here. A twisting injury can tear that, but it is not that common. And like I said, not just ligament, cartilage also. The smooth articulating surfaces can get hurt when you force invert the foot, for example. And this is an example on MRI, okay, where the cartilage is supposed to be this nice black layer, and the layer is somewhat irregular here, and the underlying bone, which is supposed to seem white in this sequence, it shows a black spot here, which shows that it has been impacted and some inflammation is happening there already. And if you were to scope the ankle, put a camera inside, and we can see that the surface of the cartilage is already eroded. And in this case, it is a full thickness defect with bone exposed underlying. Okay, and the corresponding site, which is, I hope you can see my cursor, and the corresponding site is also being degenerated already. Moving on to fracture, bony involvement, yes, can happen. The bones there are not so strong. Also, you twist or you turn it, it might break the bone. It might fail at the bone. Sequelae, obviously, they will be returned to sport regardless the severity. The more severe, of course, the longer it will take. And the re-injury incidents are possible also, all right? And some people, if the ligaments are torn severe enough, it can cause instability, and sometimes not just during playing, but also during normal walking or normal daily activity. Then that one probably indicated for operation already, all right? Performance drop is the issue, isn't it? Especially if you're a professional athlete. There's a thing called kinesiophobia. If you have been injured before, you want to return to the sport, you like having a conscious lah. You're so worried that you might get injured again. So you have some kind of phobia. Kan bola 50-50 also, you probably prefer not to take. So that will affect your performance, right? And chronic pain, especially if the cartilage injury. Remember the cartilage injury just now? Especially this cartilage defect happen when you are young, and then as you grow old, the ankle will be painful. Why? Because there's a wear and tear already. In this X-ray, it shows that on the left ankle, the joint space is diminished compared to the right ankle here. Kesian lah, this patient will have a early ankle pain. Usually we wear and tear of joint maybe at 60, 70, 80 years old, okay lah, have pain kan. But imagine if you 40 years old also, you have pain already. You still have to work, you still want to do sport, you have children to take care of, you have to go run up and down. So it's a bit difficult, affecting the daily activity. Okay, just now acute injury. Now, overuse injury can happen at ankle. Can. We have seen Achilles tendonitis that is developed into chronic inflammation and it progressed to this bump called Haglund deformity. All right. Basically, when there's a repetitive jumping, it puts stress on our Achilles tendon. Achilles tendon ni urat ketin lah, urat ketin kan. It insert into the heel bone here, calcaneum, and since banyak kali jumping, landing, it become inflamed. One day okay lah, but you play straight for a few days, 1 week, you play for months, then you will be inflamed. And when inflamed, it bit painful, you pun okay, go back home, do as usual, tomorrow you play again. The inflammation never really settles down. When it never really settles down, it will progress to a chronic, and our body will develop a calcification in the tendon and they will develop a bump here. All right. So some of you even might have this already, and may not be bothering you so much, but some people it is maybe prominent enough, interfere with shoe wearing and having chronic pain, that so much so that we may need to operate, remove the bump, as well as probably need to reattach the healthy portion of the Achilles tendon back to the heel bone. So far so good, I hope. Moving on to the knee joint. Now knee is my favorite lah, because biasanya kalau if the sport injury ni, the main food is the main cases are the knee, because it's very common for the knee injury. And again, it can affect the ligament, meniscus and cartilage also, in terms of acute injuries. And down here, I put a bigger font for patella and quadricep tendonitis, which is a chronic or overuse kind of injury, because it is more common in the knee region. Just an overview of the anatomy. We won't go through the details, don't worry. But just to demonstrate that how complex the soft tissue anatomy can be, because there are a lot of muscles and tendons and bursa around it. And not just that, we always hear the ACL, because ligament lah. It is a ligament that can be injured. Knee joint is not very stable. It is just two bones like this, lebih kurang like that lah, sitting on top of each other. So it relies a lot on the soft tissue integrity around it for it to be stable. So these are easily injured. And bear in mind, they also have the cartilage, like just the ankle joint just now, between the surfaces of the joint, all right? And in between, there's a nice cushion here called the meniscus, which also can get torn. In a pristine cartilage and meniscus, in an arthroscopic keyhole surgery that we do, we can see is something like this, all right? Nice and white and smooth, all right? Later you see the not so nice one. Ligament injury, ACL, anterior cruciate ligament is the commonest, all right? Okay, we have heard EPL player or any professional athlete come down with injury. Many of them had ACL, all right? And of course, other ligaments exist also, and they also can get injured. Sometimes it's multi-ligament, more than one ligament affected, ACL and PCL, ACL and PLC, something like that. So because it's common, I have to go through this. Since the example given here is Zlatan Ibrahimovic when he was in Manchester United, I think about 5 years ago. Usually it is a pivoting injury, where the foot is being planted on the ground, all right? Being planted on the ground and the body on top of it twists. That's when the ACL will fail. This is the commonest mechanism. And because it is so similar to volleyball, when people land after spike or block, so it can happen like this also. And I think some of you are about my age, so we will recognize Michael Owen also from this video. Who he also tore his ACL similar manner. Right foot, pay attention on the right foot, where he planted the right foot on the ground, okay? And then he twists his body on top of the knee. That's when he tore his ACL, all right? I think at that time he was still in Liverpool, or I'm not sure. I forgot where he was. And this is just the diagram. ACL ni very common. You just Google it or you just YouTube it. 100 videos will come out. The friend is PCL, posterior cruciate ligament. Tadi anterior cruciate ligament, posterior cruciate ligament. Probably in volleyball, the possibility that maybe this fall on a flex knee, that can happen, that can feel the PCL, but it is not as common as ACL. All right. The idea is all this ligament can cause instability of the knee. All right. This is the collaterals, blow from the side usually. Meniscus, the cushion can get torn. Okay. When it gets torn, it can get torn in variable kind of patterns. All right. Some are repairable, some are not. If it is not repairable, we just excise the injured part, and so that it doesn't lock or doesn't catch when people moving the knee. So example of a meniscus finding in the diagnostic arthroscopy, all right, where we scope the knee, put the camera inside, and see that maybe this meniscus in this case have been torn many years back, but not properly treated. So persistent pain come to us and scope, for example, and probably this is what we can see, all right. There's a friable edge and not so nice. This might cause some instability and can cause pain, all right. So friable, probably not repairable. Usually we just excise whatever that we can excise and leave as much healthy meniscus as possible. And if you notice, this cartilage is not that pristine also in this picture, because it's already got rambu-rambu like that. It will have some effect to the cartilage as well. Speaking of cartilage, if an injury, an impact happen, yes, it can cause direct blow to the cartilage surface. For example, in this case, over this end of the femur. Just ignore this reddish part. This is normal. Don't worry. Focus on this rounded whitish part. It's supposed to be nice and smooth and pristine, but you can see that over here there's already developed a flap like that, and also there's a hole in the middle. This is typical finding when we scope for a patient with a cartilaginous injury. Then we have to trim the edges. Trim the edges, okay, and then to make sure that it is nice and stable and doesn't cause pain to the patient. And if needed, we proceed to a additional procedure. Okay. These are just pictures of example of cartilage injury finding in a scope. Nice and healthy, probably a bit soft. This is already the beginning of injury, but as it progress, this one become like a fissuring crack already. This one a big lobang already. This one can you see underlying bone already. This is really bad lah. Okay, knee joints. I don't know if you have seen this before, patella dislocation. Okay, the kneecap can get out of track. Okay, and it can pop sideways. And when you see the patient with the knee pain, you can see a prominent bump here. All right. Thank God it is not that difficult to reduce usually. If most of the time it can pop back on its own. And sometimes the patient's friend or family or whoever is around is brave enough to push this kneecap back into place. Good lah if it is pushed inside. But sometimes we have to do it in emergency department. All right. Patella dislocation. This usually happens in female, where there's a hyperlax, as well as the knee alignment is maybe a bit pointing outside lah. So because of the wide pelvis of female. Okay. So that's the thing, isn't it? Because again, like ankle just now, the injury can happen again. It can happen again, and then it can be very problematic and devastating. After acute injury, overuse injury for the knee, all right, jumper's knee is the commonest in volleyball. This is because of repetitive, forceful, eccentric contraction of the quadricep, usually when the is in landing phase, okay? So if you do an MRI, for example, you'll see an inflammation here. But the whole extensor mechanism here, it can be inflamed, all right? Usually, it is the commonest place is the jumper's knee, is the patella tendon. Okay, we'll quickly go through the other injuries. Shoulder is one of them. We deal with shoulder a lot also. And if most of it is, again, overuse kind of thing, which is why I put this internal impingement where because in volleyball, it has a similar movement to a throwing athlete, overhead throwing athlete like that, before spiking. So the muscle can get impinged inside the joint, inside the ball and socket joint, especially when doing a very wide excursion and very forceful kind of movement. All right. But acute injuries are possible also. It can be acutely torn. It can be also have a bicep tendon rupture, because bicep tendon is just here. I'll show you picture later. And the labral tear is last but not least. Labral ni apa dia? Labral ni is this cushion at the socket of the ball and socket joint. And because it can be torn in the late cocking phase like this, in the middle like this baseball player punya picture ni, that's when it will get torn together with this long tendon which is the bicep tendon. And when the bicep tendon is torn, we have a bump here on the arm. We call it the Popeye sign. This is because the tendon is ruptured. This is the example of rotator cuff injury, where this is the scheme and this is the MRI finding, this white discontinuity here. And then when we scope inside, put the camera inside, and then we can see there's a tear. The muscle is supposed to be covered and attached here, but there's a lubang here, there's a tear. So we need to put some stitches back and anchor it back to the humerus bone. And if this labrum is torn, okay, then we have to stitch it back to the socket also. All right. Hand not so common, okay, but at the same time it might be underreported. Most of it is sprain of all these small ligament, lots of ligaments in the hand, lots of joints also. And that's why it may be underreported, but most common it may be involve the thumb. This is according to literature. I'm not sure in real life whether you have faced this or not. And sometimes it can have fracture or tendon rupture, especially when blocking, all right, where a forceful blocking can cause this bone to be pulled out together with a tendon. And in this case, on the right bottom hand corner is a rupture of tendon alone, while in the x-ray, rupture of tendon doesn't happen in the tendon, but it happens by pulling a flake of bone together also. Apparently, it is there's also some injuries to all the small bone in the hand that is associated with this maneuver that this girl is doing up here. Apparently, it's called the pancake maneuver, based on my reading, where you try to slide and save the ball from hitting the floor. This one can cause chronic injury, also chronic overuse in the hand. Last but not least is the spine, because of you are so arched when you are jumping and spiking, okay? And also one more thing is when you are landing, especially if you are landing like going to land after this bottom picture in a straight position. So if strain and sprain, usually it's because of the arching. See so many ligament and so many muscle, everything can go wrong. Anywhere it can go wrong. But a more severe acute injury will be a prolapsed intervertebral disc, or more well known as slip disc lah. And if the slip disc does happen, the prolapsed intervertebral disc can press on the nerve. That's where the problem comes. It becomes painful when it press on the nerve, and sometimes it can cause weakness or numbness to the leg also. So that's a problem lah. Okay, just quickly go through what do we do when there is an injury. First of all, we need to understand when we experience an injury, we experience pain. Pain is in a way is good because it is protective. Pain is defined as apa? As a unpleasant sense, unpleasant experience, whether it is physical or emotional, which is associated with actual or potential tissue injury. So it is actually our protective punya ni. When we feel pain, we stop, meaning we avoid further injury happening to our body, no long-term effect. So whenever you feel pain, just be patient, just take a step back and relax. Jangan continue main despite the heat of the moment and all that. Remember, there's too much at stake to lose, because badan apa pakai lama ni. If an injury happen, stick to RICE, R-I-C-E, rest, ice, put some ice pack, compression, use a bandage to reduce the swelling, tak kisahlah knee ke, ankle ke, and elevate is if possible, best if it is being elevated above the heart level, and seek urgent help. If you think it is can wait till morning, okay, do so. But if you're in doubt, just come and seek help. In UPM, you can always come to us, don't worry. There are also red flags. If you see a very deformed kind of unusual looking limb, patella bump kat sini tiba-tiba kat lutut ni, or this shoulder supposed to be nice contour, but the right shoulder seems there's a odd looking like this, or this messed up ankle which pointed inward like this. Don't wait, just come to us immediately. You probably need to do some urgent reduction. Okay, in this case, this shoulder is dislocated. In this case, this ankle have a subtalar dislocation. Okay, and if the ends of the limbs are very cold or very pale, lagi lah, even more urgent, you have to come. And naturally, if you sprain your ankle but you can't even step on it, probably an indicator of a fracture. This is apart, of course, from obvious life-threatening breathing ke circulation. I think in basic life support, probably some of you have learned this also. Airway, breathing, circulation, disability, environment. That one is more severe injury lah. Usually in sports, volleyball, probably it doesn't occur. Preventive measures, okay, I cannot stress this enough. Please stick to your warm-up and stretching. Please diligently and disciplinedly do warm-up and stretching. I've learned this the hard way. I injured my ACL 15 years ago. I injured my ankle 3 years ago because of lack of warm-up and stretching. And because of that, no more football for me. Please, we have been trained from our pendidikan jasmani time. Must do this boring stretching and all that because it is essential. Always stick to the right gear. I'm sure your coach can advise which are the right protective gear that at the same time protect you and also doesn't limit your movement, and probably invest a little bit more on a good equipment. I've read in a book before, must invest a bit of money more to the things that connect us to the earth, which is shoes. Same goes for your car tire. Splash some money lah for that kind of equipment. Okay. And communication important in the games, so that you don't collide, you don't overlap zones, you don't knock into each other to reduce the risk of injury. And of course, the more fit and well conditioned an athlete is or a player is, the less risk of injury that you will have. The better your muscle is well toned, the better your joint coordination is, less risk of injury. Things like this may be useful in your training. I'm not sure. They say you cannot spike the ball if you are too far from it because you will land on opponent's feet. I don't know how practical this is. All this is muscle memory, isn't it? When you are in the heat of the game, I'm not sure if you can apply this. But hey, stick to what your coaches are telling you, so that you don't get into injuries. For those who have been injured before, okay, stick to your rehabilitation. Please avoid the temptation to prematurely return to sports. We see many athletes already, and they usually have a higher pain tolerance, and because they really want to play, they return to sport bravely very early. So this is not advisable. You can cause re-injury again. Takkan tak tahan kan tengok Gian, tengok member main tak tahan. You must contain yourself. You must tahan a bit lah, because it can have a problem devastating effect later on. Some of you might think ankle bracing or taping might help. Okay, yes, for a previously injured ankle, yes, it does help. However, evidence suggests from literature, if you don't have injury before, if you wear or don't wear, no difference. But I guess it's up to you, because there's no hard and fast rule. As long as it doesn't affect your performance, I think it's okay. The concept of taping is to improve the joint sense when the joint is already injured. When you put a tape that is closely attached to the skin, right? So you feel more confident. I think some of you maybe has experience. You wear ankle guard or knee guard, wah, rasa macam lagi confident lah. Like if you want to play, yes, it is actually a true thing. It improves the joint sense. Something like if you stick a tape on the side of a cat, the cat can walk normally. You can YouTube this and this video. Japanese guy tape on the side of the cat. You tape on the left, the cat will walk sideways like that. You tape on the back, it will walk awkwardly different way. Because of it sends something on the skin, right? Sends something sticking on the skin. So in a way, that's how it sends feedback to our brain and improve our joint sense. Hopefully not in the way of this cat walking. So just now we noticed this article. So hopefully after an injury, if injury does happen, our aim is to go for a proper treatment and proper rehab, so that at least even after 3 ACL like this lady, she still managed to win some tournament. or even legendary Ronaldo Nazario. We know that he tore his ACL in 2000. I think it's around 2000 when he was in Inter. All right, but 2 years after that, with torn ACL, can score the winning goal in final World Cup. 2 goals plus Oliver Kahn. Legendary performance in this final. So hopefully that's the aim when we want to treat our patients who have been injured. All right, generally that's it about the sports injury. Just to remind you guys that we are running orthopedic service in HPUPM. Our clinic has been open since 2019. Please do come if you need help, and just ask for a referral from PKU, or you can come to the family medicine clinic also in HPUPM to be referred to our clinic. All right. Our niche area in HPUPM, one of it is about the sports. This is apart from the rescue, which is the stroke unit. So hopefully we can improve in our sports injury kind of treatment. All right. This is just some pictures that in action. This is the first surgery that we did in HPUPM back in April 2020. And we have progressed since. This is the example of ACL reconstruction. Here, seen here, ACL graft being probed. This is a lateral collateral. I don't have an actual picture. Sorry about that. Meniscus repair. We do an all-inside stitch of the torn meniscus and some cartilaginous procedure. And orthopedic ni, yalah, we do sports injury, but our main business is still trauma and fractures. So any case involving trauma ke, or even orthopedic infection, kaki apa infected ke apa, do come to us, please refer case to us so that we can manage. Okay, this is just our clinic load last year, 10,000 patients for the whole year. Okay, sports is one of the most active one, and our operating we have total about 500 plus, and sport is also one of the most active one. Okay, so please come to us if this emergency or just occurred, come to the rescue. This rescue is so-called the emergency department lah of our hospital. It is actually catered for stroke, but general cases can come also, no problem. All right. These are my references. Sorry for taking a bit of a long time. I welcome any questions from the audience.
What an insightful sharing from Dr. Johan. I'm sure the audience has gained ample knowledge about sports injuries that can be practiced in daily life. Now we are going to start the Q&A session. If the audience have any questions, please leave them in the comment section. Okay, Doctor, I have seen a lot of similar questions that have been asked by the audience. They ask about using ice. When actually can we use ice to apply in our injury actually?
Okay, thank you for the question. Using ice need to be as immediate as possible. The concept of ice, it is actually to reduce inflammation when there's an impact to the joint or to any part of the body. There's an injury. Biasa kita tengok apa? Swelling, warm kan? All these are process of inflammation, and the hallmark of process of inflammation is blood vessel dilatation. Logically, you must put something cold. You must put something cold to reduce the blood vessel dilatation and all that, so that the inflammation can reduce, so that the swelling is not as much as opposed to if you just leave it be. All right. This is to reduce the pain also. All right. Ice usually don't apply direct. Put it in a plastic bag, okay, and then just put a piece of cloth around it so that you don't get ice burn to the skin, and then you can tuam the thing. Every 2 hours change, like that. This can go on for days also, and then at least your dependence on painkiller alone is not that much. Hope that answers your question.
Okay, we move to the next question. Doctor, it's come from Zinyu Guao. May I ask, how does a repetitive injury affect athletes?
So repetitive ni, you play, let's say just now ankle tendonitis, right? Achilles tendonitis over the ankle. You play lot jump, okay, and then at the end of the day you feel like pain, but you kind of ignore. This is the mistake, because what you should do is you should take a rest over the next few days maybe, and take painkiller, which is also have a anti-inflammatory effect, and put some ice on it. Okay. it will affect because later on you play again, because the inflammation never settle down. You play again because you think it is quite tolerable. Oh, then the inflammation will go up again, okay? Because it never settled down, right? And then after so many times, it become chronic, okay? If repetitive acute injury, let's say ankle sprain, and then you think, okay lah, okay, after 2 weeks you don't get it looked at, after 2 weeks you go and play again, sprain again, all right? Then you will have a more severe injury. Last time maybe not affecting the cartilage, this time your cartilage might be affected already, because of repetitive injury, all right? And then you will feel, oh, then problem lah, should have seek help during the first treatment. That's why don't presume that your ankle sprain ni tak ada apa kan, because most of the time memang tak ada apa, but we want to catch this small percentage of the problematic sprain or significant injury that we might have missed. Hope that answer your question.
Okay, we move on to the next question. It's come from Easy Izu. What is the best prevention for sport injury, and does our diet affect anything on sport injury? Like if people who ate less iron or lack certain mineral in their body might have worse injury.
Okay, as far as I know, diet wise, no really particular supplement or what they call food lah that can kind of help doing this. As long as you are well nourished, take everything the normal food that we take every day, okay lah. And you might want to consider about overeating or unhealthy diet, which is quite common in Malaysia, isn't it? Because the body weight, I mentioned just now that the body weight plays a significant role when it comes to injury. The more body weight you have, the heavier you are, you can have a higher risk of injuring the knee. That's what I can say, because iron or certain mineral, as far as I know, no difference. Maybe other people can offer a better or more academic point of view on that. But typically, we don't advise our patient on any supplement in particular. Hope that answer your question.
Okay, we can go to the next question maybe. Doctor, is it okay if we just leave our injury untreated? Will it heal itself, especially when we sprain our ankle?
Thank you for the question. Ankle sprain is a classic example, isn't it? Because most of the sprain, probably 90% of the sprain, is just a partial tear of the ligament. Let's say kalau you imagine there's a ligament band macam ni, but only 10% or 30% or less than 50% is torn, okay? Chances are it will heal itself. It will heal itself, chances are. Because that's what happened to ourselves also kan, when we sprain our ankle occasionally, right? Tak ada apa ni, and most of the time it will be okay. So it's a bit difficult to say that all injury will behave like that. No, never there's two ankle sprain that is the same. That's why when you sprain your ankle, come to us so that we can see whether at least suspect that it is it's possible that it is more than just a normal, so-called normal ankle sprain. If you take your chances and it doesn't heal, then susah lah. You will find it the hard way. Main balik, sakit balik. Lepas tu ni balik. Ankle sprain until 6 months, until 1 year, we have seen before. And it is actually because of what? Untreated cartilage injury, for example. So when we check, we see your progress, maybe we will advise, maybe you need MRI lah, X-ray look normal, tapi we suspect something more sinister than that, okay? So yeah, if we just leave our injury like normal ankle sprain, you are gambling, you don't know. Most of the time, probably 80-90% you'll be correct. Don't just rely on that, because you might be in the 10-20%, then you have problem. Hope that answer your question.
Okay, we move to the next question. It's from Ngazuwen. Good morning, Dr. Johan. I have a question here. If an injured athlete undergoes surgery or surgeries, is it possible be infected by any microbes which causes inflammation?
Thank you for the question. Short answer, yes, definitely possible. We do surgery, whether we put implant or not, whether small incision, big incision, in general, 5% of risk of infection, any surgery, right? But infection ni multifactorial, right? Why? It depends on the host factor, it depends on the environment factor also, okay? For example, if small surgery, less lah, smaller wound, less lah dia punya risk of infection. If let's say patient is healthy, less lah the chance of infection. So it is not exactly 5%, but it's variable. For example, we treat a young fit guy, okay, with a small keyhole surgery. Probably the absolute chance of it must be less than 5%. Furthermore, when we do a arthroscopic surgery, we pump in a lot of water in the joint, wash out automatically some more. So less risk of infection. But how about if patient is diabetic? Patient diabetic, and then we do a major surgery, joint replacement, it won't be 5%. It will be more than that, maybe 10% risk of infection. But in general, orthopedic procedure, around 5% risk of infection. That's the rough guide from literature, at least that I can give you, and guide. But again, if your question is it possible? Yes, it is very possible. That's why when we decide for surgery or any treatment for in general, we always balance the risk and benefit as what we think from our knowledge and our experience. If we think it is worth going through the risk of infection in order to benefit the patient, of course lah, we advise for surgery. Tapi if we see benefit for surgery also not so much, risk pun quite high, maybe we also tell patient, relax dulu lah, maybe we don't go for surgery yet, we see how. So this is open for discussion. People won't be able to force you for surgery, don't worry. Hope that answer your question.
Maybe we can go to the next. Okay, from Ngazwan also. If an injured athlete had undergone surgery, what kind of physiotherapy or medication are suggested to them?
Physiotherapy is very individually tailored, all right? So difficult to say what kind of physiotherapy. Usually, in general, we will advise for pain management physiotherapy, for range of motion, meaning let's say we operate on ACL tear, right? So we will advise for the patient to move the knee from 0 degrees, meaning full extension, to 90 degrees kind of bending for the first 6 weeks, okay? Need to practice on the range of motion. So depend on the type of surgery also. And then comes the muscle strengthening, because after surgery, of course, you won't move the joint very painful, right? So the muscle will be wasted. So muscle strengthening. These are generally the physiotherapy. Tapi the exact exercise, exact regime depends on the type of cases, depends on how the patient progress after the surgery. ACL, for example, generally take 9 months to 1 year for patient to return to sport. Tapi let's say the patient return to not progressing well in the therapy, maybe it will take longer, 1 year, 3 months, depending on how the patient progress also. Hope that answer your question. Medication, as far as I know, no particular medication yang kata bagi ubat ni, patient will be okay in recovery. Not really lah. Hope that answer your question. You see, when there is we do surgery, they say apa? 50% is the operation itself. Technical, buat the ACL tunnel, for example, ACL tunnel, buat dia punya ni fixation apa semua, 50%. But 50% more is the patient punya rehab. If patient can comply to the rehab, follow all the ni, insyaAllah you'll be okay. Hope that answer your question.
Okay, it's come from Kelly Pang. If hurt on cartilage or ligament, it will affect for whole life? Is it will affect for the whole life?
Thank you for the question. Apology, I need to charge my computer sekejap. Can I just run and get my charger?
Yeah.
Okay, will it affect our self the whole life? Possible. Okay, remember just now I talked about the cartilage injury in the ankle, right, where there's a big cartilage defect, and that will progress to osteoarthritis if it is not treated well. Same in knee. In knee is even more common. We know that our mother, our maci-maci, our nenek and will have knee pain when it comes to 60, 70 years old. Tapi if you have an untreated cartilage injury, you will have that symptoms even as early as 40s or 50. We see this a lot, not just in sport injury, but also in motor vehicle accident. Remember, the main business is still trauma, the accident motor, like accident kereta. So what will happen? They injured the cartilage on top of some other injuries, and then at 40, doktor sakit lutut teruk lah, or lutut become keras lah, because of this cartilage injury. Will it affect the whole life? Yes, it can affect. I'm not saying that there's no solution lah. If we treat early, then we may be able to prevent it from happening. We may. Of course, in general, we see the injury. Of course, it won't be as pristine as before if we treat pun, but at least we can probably delay the process. Hope that answer your question.
Okay. Is there any? Yeah. Doctor, your camera is turned off. It's
Oh,
come
sorry about
from
that. Okay, all right,
Young
okay.
Minland.
Hmm.
Yeah, we can apply us or heat to any injuries. But when to use it? I think it has been answered at
Lovely.
this.
Good question, Ola. She was asking about
Oh
heat.
yeah, heat. Yeah.
A good question. When there's an acute injury just happen, you can't use heat. Remember what I said just now, because the hallmark of inflammation is a dilatation of blood vessel. That's when a lot of blood will come, and then it will appear warm and swollen, right? If don't put heat in a newly injury. Tapi heat ni is useful when it comes to probably an overuse injury, but not exactly at the joint, but at the muscle surrounding it. Faham tak? For example, you have a knee injury, for example. Knee injury, you put ice directly on the joint. But at the same time, after a certain time, you will have tightness on the muscle, on the thigh muscle, for example, or on the calf muscle. That's when you put your heat therapy there. So usually heat therapy ni kita pakai apa? Either maybe cream, minyak gosok lah yang panas tu kan. For example, methyl salicylate ointment, ataupun yoko-yoko kan, ataupun yoko-yoko can, but you don't put it directly at the joint, at the injured joint. No, you put it at the muscle. Or put a hot water bottle, tapi itu a bit ni lah. Can, up to you. But when to use it, don't use the heat when just injured only. It is more for a long term, or later on lah it will come. Hope that answer your question.
Okay. The next question is come from Hong Yi Lee. If an athlete develops a chronic or recurrent injury during competition, does this mean that the athlete will not be able to play a significant role in subsequent competitions?
Okay. So a tournament is going on and then you get injured. Depends on the severity of the injury. All right. That's why assessment by the best, if you have a team medical team, a medical team for the squad, can assess you and can kind of pass you for to play for the rest of tournament or even for the rest of the game. We see this often, right? Player in EPL jatuh tergolek and then physio datang tengok, okay, sambung main. Usually probably it's like that. Maybe a bit of a drama and faking injury, but that's the concept. You need to be cleared by somebody who is medically trained. So then only you can continue. I know that it is not. It is probably a bit impractical to say sakit sikit, oh stop, sakit sikit stop. No, better seek treatment first. Meaning, if a medically trained personnel say, oh, this is okay, or oh, you must stop lah, better stop. In that case, maybe it's best to follow. I know, but sometimes when people have a lot at stake, a big tournament, wakil negara ke apa, sometimes we kind of forgo our health interests. That one is up to your judgment lah. Because I can't say yes or no. But being a medical personnel, we have to advise the patient and give the clearest picture that we have at that point of time. And if that involve need to stop for the game or need to stop for the whole tournament, I would suggest you do the same. Too much at stake lah. You belah badan nak pakai lama ni bang. Jangan jangan main-main. Something like that lah. Hope that answer your question.
Okay, thank you, Doctor, for answering the question. It looks like we do not have much time left for this slot. That will be all the questions we could ask to our speaker from our participants. Thank you once again for the interesting sharing, Dr. Johan Abdul Kahar.
Thank you guys. Thank you.
Yeah. We look forward to having you again next time. Thank you so much, Doctor.
Thank you for inviting me, guys. Thank you.
Now I will pass the floor to our moderator, Ms. Chai Jia Yue, for the talk session with Ms. Zilane. Ms. Chai is a former national athlete in synchronized swimming. She specialized in duet routine event and had qualified to compete in several big competitions such as FINA and SEA Games. She is also the director for this program. Before that, I need to mention that we are sorry we can have Miss Tiffany with us today due to any problem, and we must go with the slot 3 first due to some issues. Thank you I'm sorry in advance for everyone. Yeah. Now we please welcome our moderator Chai Jia Yue.
Hi, good morning, everyone. Watching our live stream right now. My name is Cai Jia, and as the MC introduced, I'm the director of this program, Webinar Sport Injury and Athletic Stress, and I'm also the moderator for this section. So, for some of you, you may know that I'm a ex national artistic swimmer. So, if you don't know what artistic swimming is, I'm just going to describe it as dancing on water. But if you still don't get it, you can Google it up because we're not here to talk about artistic swimming. We're here to talk about sports injury and athletic stress. So I'm going to bring out one of my old teammates, my ex teammate. I would say old, my ex teammate Zilaine Lee Yinghui to join me for this session to share her thoughts and opinions about sport injuries and athletic stress. So let us give a warm welcome to Zilaine Lee Yinghui.
Hello.
Hi
Hi everyone.
Zilaine. Long
Hi.
time no see.
Long time no see.
It's been so long, right? I think the last time we met
Yes.
was after SEA Games,
Yes,
2017.
2000. Yeah, around there.
Oh, it was so long. It's 2022 right now. Oh my
Yeah,
god.
true.
The last time I saw you, I remembered you had an injury on your shoulder, right?
Shoulder.
Is
Yeah,
it? Is it
yeah.
your shoulder?
Yes. That's the
Yeah.
latest one.
Would you like
Latest
to
and
share
hopefully the
about?
last one.
Oh, hopefully the last one. Yes. No one wants to keep getting injured. So,
Yeah,
would you
true.
like to share about your injury from the like what is the cause and how are you dealing with it right now?
Okay, my latest injury was like Jai said, my shoulder. Apparently I have a stage 2 slap, which is for an athlete is not a very good news. Based on the doctor that treated me, he said that it might cost my athlete's career. So how does this develop is due to overstress and overtraining. Without treatment. So whenever I have a shoulder pain or shoulder sore, I didn't go and treat it well. I took it very lightly. Along with training, I do not have time. At that time, we didn't focus more on recovery. So we just train, and at the end, it overstressed my shoulder, which led to a slap. And then I had to go for 2 surgeries to fix it. Yeah.
So you already went for the surgery, right?
Yes, I already had 2 surgeries on my shoulder. Yeah.
It's very stressful when you have the injury and then you still have to train every day.
Yes. Yes.
Yeah, we were training together and then it was obviously from morning to night and then
Yeah.
it's really hard to find a session to go for any therapy with all the ongoing tournaments and all.
Yep.
So
If you have a tough schedule with very little knowledge, or maybe your coaches or your team managers are unaware of this rehabilitation and also to do physio and stuff, then you won't have time for recovery. I should say that. Yeah.
yeah. So oh my god, I'm so sorry.
It's okay.
When when this injury occurred, like did anyone help you through it? Like parents or
Um,
friends?
At the moment, while developing before my surgery, no one really helps because I myself thought that, oh, it's just a muscle sore, or maybe I'm just getting old, that I have joint pains and stuff like that. So didn't really bother me. I didn't really want to tell anyone because people might say, oh, your pain tolerance is just very low and stuff like that. So at that moment, no one kind of like support me on what to do next. once it got very the pain is intolerable, so I myself went to the doctor and seek help. From there onwards, we know how serious the injury is. Then more people will come and like, okay, you should do this, or maybe you should find a second opinion. Since it's so serious, maybe you should find a second opinion and see what the other doctor said. And from there, we start moving on. From there onwards, then I got more backup, like from my parents, choose to decide which doctor to trust and which doctor to see, and how do we want to proceed from there and stuff like that. Yeah.
So it really starts helping once you start sharing this problem out and not
Yes.
think it's just a common sore or anything.
Yes. Yes.
So since you said you had the surgery, so like did you continue training after that?
After the first surgery, I did continue training, and then I went for a competition, Asian Games actually, 2018, but it didn't solve my problem, so I went undergo the second surgery after 2018. Yeah. From there on, I stopped training due to circumstances. So yeah, I didn't train after that. Yeah.
I think we have a question from the floor.
Sure.
Does surgery influence athletic career? Like it may cause the absence of competition.
Oh, thank you, Cheng. Definitely. Once it also depends on your seriousness, or how bad is your injury. To different people have different opinion. Like for me, I'm those type who like small injury, think that it's a small injury, we will continue to train or maybe go for competition. Because like just did we mention that during I have this shoulder injury, I was competing in the SEA Games 2017. So yeah, I thought it was a small injury, so I went and compete. It didn't turn out well because of course the pains and the restriction of movement bothers my performance. But that's individual lah. If some individual they take it seriously, they might have to set back some of their competition due to injury. As you can hear, many of the sports athletes, not even Malaysia, overseas, like footballers, those great footballers, they will say, oh, they would step down on this tournament due to injury. It's quite normal for uh, athletes to step down or not compete in the arena when they have injury. Yeah.
Yeah, true. Since because our sport is like a full body sport, and then you have to like move your whole body around. So any minor, I wouldn't say any minor injury, like any injury on the body would really affect our performance in the
Yes.
competition.
Yeah.
And
Agreed.
so like since you said the injury affect your performance, like did it any in any way affect you mentally?
Oh, definitely. If I think it's quite normal when, even though when you're not an athlete, you feel something is aching. Your whole schedule from morning, once you wake up until at night, you will feel the pain. So it will bothers you somehow. Whether you
Yeah,
are
true.
working, you're driving, you're walking, you're studying, definitely it will bother you. So it does affect us
Affect you.
mentally. Yeah, because the pain is there and you can feel it, and you cannot, other people cannot see it. So people won't understand if, let's say, you're down, you're quiet, you're like, why is this person so quiet? And it will also affect you in a way like, should I tell that person that I'm having this pain or not? So it
Yeah,
definitely
true.
will affect. Yeah.
Because if we do tell, and then like you said just now, maybe people will say like, oh, you have such a low pain tolerance like that.
Yeah. Yeah, that's why. So it will affect you automatically as a human being. You would want to think that it doesn't, but it does. Because you
Yeah,
yourself
true.
will know, okay, I'm having that pain on. Some people might overthink it. Oh, is this pain like serious? Will it lead to something else? It will definitely make you think, is
Yeah,
other thing
and
too
even
much or not? Yeah.
yeah, and then as athlete you will start to think like what affects my future in my
Mm,
sports, and then
yeah.
like what if my performance goes bad, what will happen,
Yes.
will I disappoint my country, will I disappoint my coach,
Yes.
stuff like that, and then it starts to run the mind.
Yes.
So like we mentioned this mentally thing. So like we said, like people will say competition and others may lead to like athletes to be stressed.
Mm-hmm.
So like do you have any other opinion like why do athletes stress?
Why? Yeah. Mainly,
Yeah.
as an high profile athlete, you want to perform well. That's the you have trained so hard, trained so long hours, put your sweat, your blood, your
Blood,
tears in
sweat
it,
and
and you
tears.
yeah, and you want to perform well at that moment because at that competition is your time to shine. Like for us, synchronized artistic swimmers, that's the only, let's say, your routine is 3 minutes. That's the only 3 minutes in your life that you can prove to everyone that how hard you have trained, how much you have trained, how much effort you have put. Of course, you don't want to make it, you don't want to like take it easy, and also you want to perform as well as you can. You should not you should well you want to at that time of the moment you want to perform your best. So this will make you some give you may some individual may give you give it confidence, like okay, I've been training so hard, I need to prove. But some were like, oh, I train so hard, do you think like what if I don't improve, I mean what
Yeah,
if
the
I don't
negative
swim well?
thoughts start
So
to fight.
yeah, yeah, so that also
Yeah,
gives you
I get
stress.
that. Yeah,
Yeah.
okay. So I think I think we have a question from the floor. Can
Okay.
I? How does Zilane manage the stress during those injured days from Yazun?
um how do I manage my stress? Take one step at a time. I would tell myself that, because nothing is as quick as eating or drinking. Like something that you love to eat, eat it very fast. It's not as fast as that. Injury and recovery take a very long time. Some can take to 1 month, some can take to 3 months, some can even take to 6 months, and you're still not back on your feet 100%. So I would tell myself to take one day and one step at a time. As long as there's progress and there's improvement, whether how big or how small, is still a progress. Yeah.
Okay. So there's another question. Hi
Hi.
Zilane, how much time did you spend training each day? How do you manage your body and posture?
Oh, hi Lee. How much time did I spend training? Well, I can't calculate the hours. I mean, yeah,
Oh,
I
it's very
started.
hard to calculate the hours.
You can calculate yourself. Okay, so I'll give you a backstory. I started synchro when I was 4 years old. I entered national level when I was 13 years old, and I stopped when I was 27, right? 27.
so
Yeah.
so it's
I'm
like
30 this year,
2020. Oh,
right?
okay. Are
So
you?
yeah, about 20. Never mind, my age is not an issue. Yeah, I stopped when I was 27. So that's the number of years I've been training. And how much time? Okay, since I'm a national, once I enter national, my training time is from 6:30 to 9:30, no, 6:30 to 9 in the morning, 3 to 7 in the afternoon. So that's my standard. Yeah. And
And
then if let's
that's not
say,
even the before tournament training time. That's
yeah,
just the
before
normal training
tournament
time.
is a different story. You can add again from let's say maybe 8:30 until 12, and then we start from 2 to 7. Yeah. So
Oh,
you can
oh, I
calculate.
miss those times. I miss those times where you just sit there and then you sit by the pool and you start to think about life.
Yeah. Yeah. You start wondering, why am I here?
I'm quite curious about the question. How do you manage your body and posture?
Okay, manage my body. I have to thank my parents that I have good posture actually. My sister, on the other hand, she's also a ex-national athlete and artistic swimmer. Her posture is not that good. I think is well, she works hard to have her posture as we have as an athlete, especially an artistic swimmer. We must have a good posture as judges will how do you say will judge based on
Yeah,
once we
true.
start walking to the stage. So you must have a
Once we're
good
on
posture.
stage, the posture is very, very important.
Yes, so that's how we train. A lot of practice, a lot of training on your muscles that are weak to maintain your posture and stuff like that. So you need to know your body well. Where are the weakest point? You have to work on it. Yeah, that's how we manage.
Okay, so since we're talking about stress, and then like you're a student of UPM, right?
Yes.
So what course are you in?
uh, Food science and technology.
Food science and technology. So it's like balancing studies and sports at that time,
Yeah.
right? When you're still an
Yes.
athlete, it was balancing.
Yeah.
So
Mm-hmm.
how do you actually balance your studies and your sports? Because I know I'm bad at it. I'm really bad at
What?
balancing my sports and studies. Look at my
No lah, where
CGPA,
got?
it's right there.
My CGPA is also not that good. Well, actually, I'm having a hard time previously when I want to balance my sports and study because like I mentioned before I started synchro when I was very young. So
Yes.
when I even, how do I say, my playtime is more than studying, I could say like that, because at 4 years old I already start swimming and doing synchro, so more of my time is on training. So and at that time I have a problem, dyslexic problem, so I can't really sit down and pay attention on books or maybe reading, studying. I'm not very good at it. But thank God at 12 years old I got better. I overcome my problem. Well, I shouldn't say it's a problem. Well, my issue. From there on, thanks to my parents also let me into Bukit Jalil Sports School. That's how I managed to balance. So we have training in the morning, school in the morning slash afternoon. So my school is Bukit Jalil School is about 9:30 to 2, right, Jai? I
Yeah,
forgot
9:30
about
to
it.
2. And
Around
then
there.
and around
Yeah,
there.
so so 3 we would start training again until 7. So from there on we already have the schedule. So from Form 1 until pre-U, maybe from 6, I we have
From
this
6 for
schedule,
some
same
people.
schedule. Yeah. We have this same schedule where we train, study, train, and then at night we might have classes as well. So from there on I developed, okay, morning focus on training. Then when during school I might be tired, but I will try and push myself to focus on school at that time, academic at that time. Then at the end, afternoon training, then I would focus on. So for me, I would say at this time I need to focus on what? Make sure my priorities are at this, and I do not lean to the other side. So
Yeah.
that's how I
It,
did. Yeah.
it's actually quite good that like that the sports school they actually give time to let you arrange your own
Yeah.
time, training
Yes.
and studies, and
Mm-hmm.
they actually have a night session, another night session class
Yeah.
from
Yeah.
8 to 10. If I'm not
Yeah.
8 to 9, something like
It,
that.
it
So
around there. Yeah.
around there. So it's like even if you do think like you can't catch up with your studies, there's always this night session that actually helps you.
Yes.
The teacher actually
Yes.
the teachers there are really amazing, right?
Mm-hmm. Also, I
So
feel like to add again on that, you have to be disciplined as well. You
yeah,
might
true.
have a schedule, you need to be disciplined and you need to be like, okay, I must focus. You cannot like, I'll do it at night. I'll do it in the morning. You cannot do that.
I was
Yeah.
like that, and then it ended up really, really bad.
Yeah.
Everything was
This
last
is,
minute, and it was very, very
mm-hmm.
stressful.
Yeah.
But yeah, so I have another question from the floor.
Okay.
How is from Nafa? How long miscellaneous injuries take time to recover, and how you manage your mental during that time?
Mm, how long does I
How long
take my
did your injury
injury?
take to recover?
I would say, okay, different injury. I have different injuries.
What about
Those
the
minor.
latest one?
Okay. Okay, I'll like to add on this because it depends on your injury. Like for me, I have many injuries. Like I have more minor ankle sprain, or maybe I think that's my least. That's my
The ankle
minor,
sprain
the
is really
most
like the
minor.
minor, yeah.
Yeah. So that one took about maybe 2 weeks, 3 weeks, and 1 month later, I would get back on my feet and to train. Once the swelling and those not that sharp pain wear off, I would start training again. Whereas the most serious one was my spine. I have a concussion, kind of like concussion, and my spine went. So that one
Oh,
took a long time. Yeah, that because it involves my spine and it's a very hard place to how do I
recover
say?
and
Yes,
even treat.
recover.
Yeah,
Yes. So that would take. I think that took me 2 3 years to get. I mean, um to be
able
how do
to
I say?
compete and train
Yes.
hard.
But then at the same time, it doesn't recovered 100% on this on my spine injury. Yeah, until now I still have my fingers are still numb and stuff like that. So some injuries they take longer time and you won't recover 100%. You will
Yeah,
maybe
I
recover best 99%.
it's still that's why they say like the injuries you can't really take it how to say you can't take it
Lightly.
lightly. Yeah,
Yeah.
because like you said, the spine you went like like that, so it really affects your whole life
Yes.
in general. So I
Mm-hmm.
had I had an injury too on my arm, if you remember, like the elbow,
Yeah,
and
yeah,
then from doing handstand, yeah, and then
yeah.
it's the same. It still gets numb from time to time. It sometimes still hurts. I can't
Mm-hmm.
straighten my hand for a long time. Yeah, so it really affects athletes. If you do get injured in the places that are really hard to recover.
Yeah, that's the stress part. Well,
Yeah,
on the
that's the stress part.
second question was manage your mental during that time. I
Yeah,
think you just have to beware sports, not even sports. Okay, sports is a more advanced thing. Even walking down the stairs. Okay, you might get injured. Okay, some even wear high heels, walk for 5 minutes, you can sprain your ankle.
that's
Athletes
true.
don't say
That's
lah,
true.
confirm will have injury one. So you just need to know that if you if you have an injury, what you should do. As previously, the previous session, Dr. Johan already mentioned how to treat it and stuff like that, right? So
Yeah,
at least you're aware on the basics on what you should do if let's say you have a minor sprain, what you have to do, who you have to see. You need to be very clear on what to do. Then I think you won't be so stressed. Yes, you'll be stressed, but not so much. At least you have everything laid for you. What's the next step you should take? Okay, if let's say this doesn't happen, what should we do next? So I think that really helps me a lot when I have everything laid out and see which one should I go. Yeah.
so it's really important, right, to know like what about sport injuries in that way, like
Yes.
how to actually
Yes.
deal with it, and not just
Yeah.
know,
You need to
oh,
be
I
prepared.
sprained my ankle, so what now?
Oh, you just leave it. Yeah. Yeah.
Oh, just
Need to
leave it
have
there, it's
basic
just an
knowledge.
ankle. Yeah, true.
Yeah.
If not, it really affects the like if even if it's sprained ankle, someday when you walk you would suddenly feel pain. Either
Yeah.
way, it's just
Yeah.
that's how injury works, it's just like that.
Yes.
So okay,
And at that time you
another,
are young, right? You were like, okay lah, I'm still young, I get back. But wait
yeah.
until you're my age, you can feel it.
And that's why they doctors always say like you might not feel the pain now, but
Mm-hmm.
maybe when you reach your 30s or 40s, then the pain will actually come back. So
Yeah.
never ever take an injury lightly.
Yes. Yes.
So
Agree.
I have another question
Okay.
from Yuran Wu. May I ask, how do you adjust when you feel stressful in training?
How do I adjust? Very good question. Um, how do I adjust? Well, for me, I would go all out. Let's say for instance, I'm an artistic swimmer. We have to swim. We have to train swimming. So when I'm stressful, I would swim
Swim
faster,
really, really fast.
swim away. Yeah. So that's how I release my stress when I release it on a positive way. In a way, swimming very fast is a good thing because it builds up my stamina, it builds up my speed, it also builds up my muscle to swim faster. In synchronized swimming, we need to have ability to swim fast because of explosive power. So I would find a place where I can, how do you say, lepas geram? How do you say that in English?
Really stressed.
Yeah.
Release
So
tension,
that's
something like that.
so for me, I would swim really, really fast so that I can let my stress out. Yeah, that's how I release my stress. Now you
But you
know,
release
Jai,
it in
now
a
you
really
know why
positive
I
way.
swim very fast.
Yeah, I keep thinking every time, how do you guys actually swim so fast? Because I swim so slow at the time. Because some at least you release your stress in a positive way. Some swimmers, they just like splash the water really hard, or maybe throw
Yeah,
their equipment, something like that. That's how
true.
that yeah, that's a very negative way to like the water
Well,
didn't do anything wrong.
true in a way, but any I shouldn't say that I don't have equipment to throw. If I have equipment to throw, I might throw too.
I think we have no skips to throw at that time.
But if you throw, then you cannot swim anymore.
I have backups. Okay, so she asked about stress during training. What? How about like daily basis, like during your
Mm,
normal days?
like right now, I'm quite stressed at
Yeah,
work. I would talk to someone,
you talk
or
to
if
someone.
that's yeah, I'll talk to my peers, regarding like just to let go, let it out, and don't bottle it inside. I find that if you keep it inside, the stress will build up.
Yeah, true.
So for me right now, I would start talking to my peers, and if let's say the stress is still building up, then I would go to the main source of the stress coming from. So to tackle it, to like understand what's wrong with it, how can I solve that problem so that I won't be so stressed. Yeah, that's how I deal with my stress on daily basis lah.
So
Besides
besides
training.
talking, do you do anything like personal activities, maybe meditation, or maybe do like anything
uh
anything that calms you?
Right now, I start playing video games. Last time I do not, but maybe now that I have more time, I'll just start playing video games. I think that takes my mind away from what I'm having, what are the problems that I'm having lah. So you guys have, if those that are stressed, maybe if finding someone to talk to is hard, maybe you can find something that you like that doesn't harm anyone. Yeah.
It harms the characters in the games, but it doesn't harm
Yeah.
anyone in real life.
Yeah, humanely, it doesn't harm anyone. Yeah.
I would ask what game you're playing, but we're not talking about video games right now.
Okay.
So I
We go.
will
Yeah.
go to the questions from the live stream.
Okay.
So I have another question from Alpha again. So can you share a bit about your achievements in swimming synchronization, and when is your best achievement?
Share about my achievement. Wow. I think from my
That's
achievement,
a
you can
lot.
see my best achievement. Okay. Just to cut short, I attended three SEA Games, 2011, 15, and 17. All of them, I had goals. As in, I won goals, not gold, not yeah.
A
I
lot of
have
goals.
kind of okay. So from there, and I have attended two Asian Games, 2016 and 2018. I didn't win any medal, but we performed well. I have went to three no yeah, three world championships. Also didn't have any medals, but we did increase our rank from there. And then the rest was like Sukma, and then normal major minor competition, local competition. So mostly our international competition, the big one are the one that is FINA hosted, which is Jai. Which one are the
uh,
FINA hosted? World
Asian
champ.
Championship, World Champ.
Yeah. Yeah.
Yeah,
So all these big.
anything you can find a FINA logo, yeah, it's them.
Yeah. So that's are my highest achievement. Too bad I haven't got into Olympics. So yeah, it's too
Yeah,
bad.
that kind of bad. But then actually, like in terms of competing, in the end, you just think as long as you did your best, that is the best
Yeah.
achievement.
Yes.
Okay.
Agreed.
I'm gonna move on to the next question
Okay.
from the floor. From Hemini, how to be a national athlete like you, or maybe an advice to others who have this passion to join our national team and represent our country? Oh, nice question.
Very good question. To be like me, athlete to be like me, no need to be like me lah.
It's actually quite funny
Uh,
when people say, I want to be like you. It's like, I don't think you
yeah, a
want
bit
to.
like I'm not that great lah.
Because you need to take artistic swimming.
Okay. Well, I would say start. No matter where you are, start first. Like for artistic swimming, the best is to start when you are young, because that's when you start absorbing fast. That's when you have your flexibility. That's when you can willing to try anything without fear. As you grow older, there's fear coming into it. So I would say start young, but at this age, at university age, I would say you can have your fear, but try and start. Okay. From maybe university, you can start playing the joining co-curriculum. We have co-curriculum, right? This is for co-curriculum course,
Yeah,
right?
this is actually for co-curriculum QKS
Yeah.
2120
Yeah,
volleyball.
so I see it's a volleyball. So from there, it's a good start that you're entering this co-curriculum. You can start doing. They will teach you basics, I believe. If let's say
Yes,
you don't have any basics, yeah. So from there, you develop it. You work. You can train from there, and maybe if you're good enough, you can try out for masum. Is for inter university, right? There's inter college.
inter college, they also inter college, but
Yeah.
I don't think they offer. Did they offer swimming competitions?
Don't be artistic swimming, but because let's take for example, there's volleyball here, right? You're having
Yeah,
volleyball
yeah,
class, so I believe you will have volleyball games among colleges like K5,
yeah, yeah,
K6
yeah.
and
There
stuff
is,
like that.
there is.
Yeah, so you start participating in them, and then if you're confident enough, maybe, or if you're good enough, then you can participate in, if I'm not mistaken, it's called masum. Is for not inter, it's for university. So like UPM, they
University
will compete
between
with.
yeah,
Yeah,
compete
yeah,
with other
yeah. So
universities.
from there, you can develop to be a better player. You might not be a national player, but you're still developing there. And maybe if let's say there's
Yeah, you're
a
growing
chance,
yourself in a way.
yeah, and if there's chance, the national coaches might see you, and from there you might get to be pulled into the national athlete. So that's the best case scenario lah. So you need to work your way up. It's not an automatic thing that okay, I want to be inside a national athlete and I want to go there. It's not a one day thing. You need to develop yourself.
Everyone starts somewhere. So at first
Yes.
you have to be I would say dumb enough, because I'm dumb enough to actually go for artistic swimming. Like
Why?
it wasn't my intention to actually join artistic swimming at first,
Okay.
but then I
Yeah.
start to love like really
Mm-hmm.
start to love the sport, and then I just continue on in the end
Yeah. So
until
I feel
until
you
I
should
was
be
18.
open minded. Yeah, you
Yeah,
should be open-minded. You shouldn't be stuck to like, okay, I want this spot. It's a good thing that you have your goal. Okay, I want to be in, but also open your door. Make sure if let's say an opportunity come in, says, oh, maybe you're built this way to be in this spot. Would you consider it? Don't just be so close every door and say, okay, I want this one only. The rest I don't want. You cannot do that. Yeah,
and you
you
also
have
can't
to
let
open.
fear like and anyone other's opinion is like, oh, if you
Yes.
join this, then you would like do there would be something bad happening, and
Yeah.
then you let
Yeah.
fear get the best of you.
Yeah. Agreed. That's right. Yep.
So I'm gonna get next
And
question from the floor.
okay. Hi.
From Najuan. Hi again, Zilin. Why you choose to go swimming for a long time since young? What is the main factor, tulang belakang, that
Okay.
support you to continue artistic swimming although you face some problems?
Very nice question. Okay. Why did I choose swimming? My whole family
Swims.
teaches and involves swimming. Okay, so my dad was a water polo player and a swimmer back when he was in the Air Force. So from there, he got his basics on swimming. So he taught me how to swim. And my mom coaches started the first batch of artistic swimming. Last time we call it synchronized swimming in Malaysia. So that's how I got pulled into artistic swimming, because I would follow her after school just because she will be coaching and I'll be like tagging along lah. So that's how I got involved. What's the what's the main factor and the support you continue? Okay. I didn't really like the sport at first, just like Jai. I I was more interested in swimming because of my size. Because of my size, my build, I'm good at swimming. However, artistic swimming at the time wasn't that popular. So why not
Yeah,
give it a chance? Yeah. So from there onwards, slowly developed. Training might be hard, but I fell in love with the sport because not many can do. When you tell people, "Oh, I'm a synchronized swimmer," they will say, "Oh, I like that sport, but I cannot swim." "Oh, I like to
yeah.
see everyone
Everyone
dance,
says
very
that.
pretty." Yeah,
Yeah,
and then it's like, but I don't know how to swim. I'm very scared. So it's something that everyone likes to know about it, and everyone, most of them do not want to try
they
because
fear
they would
they
say,
fear swimming.
yeah. So they are fear of water, I would say. Also
Yeah,
because
yeah.
during maybe primary school, swimming wasn't a PJ session.
Yeah, yeah,
In
it wasn't.
PJ was just more on running, or maybe badminton and stuff
Yes.
like that. So
Yeah,
I
yeah.
think that's why a lot of people scared of swimming unless their parents themselves bring them to a club and stuff like that. So from there
Yeah,
on, I know synchronized swimming is quite special. So that's why I would want to make everyone aware that synchro is there and it's fun and it's quite nice to be in. You feel
yeah.
special. So every time, I don't remember not Jai, every time when when we are training in Bukit Jalil, and let's say there's a lawatan and stuff like that, a whole group come in at the spectator stand and everyone
Yeah.
will be like, so it feels like we are in a zoo, it feels
Yeah.
like, wow,
It's like it
this
we're
this
the
dogong can
entertainment.
play ball lah.
It's like,
Oh
wow, they're
yeah,
swimming in water. Wow, you can
yeah,
see their legs coming up. Wow, that flip.
yeah, yeah. So
It's really
I think
entertaining.
from agree. That's why I think I like to see their faces. They're like stunned faces. So
Yeah, especially
that's
especially those kids. I like to see those kids when they're
and then it was show, mommy, I can. So yeah.
it was like,
That's
Mom, I want to
how.
join. I want to do this. I want to do this. And
Yeah.
then, and
So
then the mom
that's how.
was also afraid also because they see the flips and
Mm-hmm.
all. Yeah, and then the
Yeah.
parents start to fear.
Mm-hmm.
So
Yeah.
like it's
That's
kind of a
another thing
challenge
too.
to like try to convince your parents like I really like this thing. Even if it's
Mm-hmm. Yeah.
dangerous, I want to try. It's
Yes.
sometimes it's hard for some people to convince their parents in that way. I know my mom was
Yeah.
hard.
True.
My mom was
My
hard when
parents
I
was too.
yeah
Yeah.
the splits and all. I was crying, and then
Mm-hmm.
my mom was very she was very worried, and it's like, do you still want to go over there? It was like, yes. It's like, but you're crying, but it's fun.
It's
It's just that
fun.
way. Yeah, it's fun until you get to nationals.
Yeah. So in
Okay,
a
so
way,
I'm
it
good.
depends.
Yeah,
Yeah. Okay.
it really depends. Okay, next question from the floor. From you, Sijia. Do you have any memorable moments during the race? Maybe it's like during
Competition.
any tournaments. Yeah,
Yeah. Memorable. The ones that I won, the ones that you are up on
up
this
on the stage
podium.
getting the medal.
Yeah. So that's always the memorable, whether how small or how big the competition is. That's the best place you want to be after your competition, lah. Because that's the ultimate thing. After you train so long, that's the place that you want to stand. So yeah,
It's
that's the
like
most memorable one.
3 years of training for 3 minutes of performance
Yes.
for that 3 second on the podium.
Yes,
it's,
exactly.
it's
Sometimes
exactly
even
that
more if
feeling.
you
Yeah.
have Nagaraku.
Yeah, true. If there's a garang playing or like during Sukma, your state anthem is playing, you
Yeah,
get
yeah,
a few more minutes of stage time. You stand there.
yeah. So that's the
So
most memorable one. If you have the
yeah.
chance, do let me know whether is it memorable or not, no matter how big my house is.
Yeah. Okay. So and next question. What is the
Ooh.
best age for synchronized swimming? Oh, this is a
To
really tough one.
start or to
Yeah,
retire?
I think it's to start, but you can share to
um,
retire if you want.
well, I would say earlier the better because artistic swimming or synchronized swimming, we need to be flexible, we need to be flamboyant. Old person like me wouldn't do an oversplit anymore. If you yeah, so as early as we as it could, not only synchronized swimming, other sports also, it's better to start young lah, when you're agile, when you can absorb faster, and also when you think is everything is fun, is playing, is
Yeah,
not
where
serious.
everything
Yeah.
is fun, really. Where you want to go? It's fun.
Yes, it's fun. You from fun, then you develop, and you will fall in love with the sport. Yeah,
Yeah,
that's what I would
it's true.
say.
It's true. Yeah. Okay. So I'm gonna get another question from the floor.
Okay.
What advice do you have for athletes that have undergone serious injuries now that they can't play anymore?
Ooh, advice. First of all, I would say sorry. If you really love the sport, I'm really sorry if you can't play anymore. I understand that it's a very harsh, how do you say, news, because I
Yeah,
had
it's
that
very
news
very harsh.
before. Yeah, but life goes on. Sports is not everything. You can move on to other things. You can even join other sports that has lower impact, like
Yeah, true.
maybe less impact. So maybe like what is less impact? Dart,
Shooting,
shooting,
shooting. Uh,
archery. Those
yeah,
that is less
archery
in. Yeah, yeah. So
doesn't
you can
require
always,
too much body movement.
yeah. If let's say your injuries are caused by harsh impact, or maybe how do I say, those that really requires you to run really fast, or maybe like let's say you're in a dojo or a karate sport,
I
you
think
can't have
like intense body movement.
yeah, yeah.
Any
So you
sport
can
intense
move
body
to
movement.
a next sport that require less impact lah. If you do not want, it's okay. You can just do a light jog and stuff to keep yourself healthy and stuff like that. So you have to make way. You have to think what is the next door for you to step in. Yeah, don't just stuck say, oh, I cannot play, and then I'll stuck in my room, just continue with life. Yes, you continue with life, but try something else.
Yeah, true. Because some really just think like I just know this sport and I've been playing
Mm-hmm.
it for years.
Mm-hmm.
So like what if I do change sport, like would I be any good at it, or would
Yeah,
I really yeah. It's the it then it comes the mental part. It starts
true.
fighting the brain again.
Yeah, agree.
So okay, another question
Okay.
from Naufal again. Hi Naufal. Do you have any other sports that you love to play apart from synchro swimming?
I wouldn't call it a sport. Is it a sport? Well, I like scuba diving. Is it a sport? I don't think so. It's a sport.
I
More like
it's not,
activities lah.
yeah, more like activities. But it's
Um,
actually quite fun, right? Scuba diving.
yes, yes, it does. It really opens up another world. I like wall climbing, but in Malaysia it's quite expensive. So yeah, I would go
But
once in
wall
a blue
climbing
moon.
is now an Olympic event, right? They
Yeah,
climb.
yeah, 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 yeah. That's called bouldering, right? If I'm not mistaken, called bouldering. Yeah, something like that lah.
I just think
But
it's climbing either way.
yeah, yeah, that's about it. Nothing else. Other sports is quite interesting too because I've been training synchronized swimming for my whole life. Kind of like maybe not whole life, maybe one quarter
More
of my
than 20
life.
years. More than 20 years.
Yeah. So other sports is quite fun to me, but I love to is scuba diving and also wall climbing. Yeah.
Okay, thank you. And we're gonna go to another question.
Okay.
Hello, Zelaine. As a national athlete, what do you hope could be improved in the future to better help swimmer?
Good question. Hello, Sun Maoja. Did I call your name correct? I'm so sorry. Uh, what do I hope? Um, I would say have a better support system for a national athlete because our we might study a lot of people are studying sports science, but not all are applying sports science in sports at that time or at during my career as a
Doing
national
your
athlete. Yeah, not many are taking the knowledge into consideration, but else they are following more on, let's say you're taking how do you say foreign coaches because their country performs so well in that sport, you would tend to follow their way. Sometimes not every athlete can follow the way that a foreign country works. Sorry,
Yeah,
I need to
true.
clear my throat. I'm sorry.
It's okay. It's
So
okay. We're both clearing our throats time to time.
okay, so from there onwards, I really hope that moving forward for the future athletes, more using more sports science would be helping a lot because we can take other foreign ways to train our athletes, but please do consider our sports science. I think having sports science both culture is a good thing when it comes to sports, not just following one way, as everyone is built differently, everyone learn a sport differently. So I hope in future they will help not only swimmers but all our national athletes to have a better
Yeah,
support system in that way. Yeah.
because like some countries, because our coach was from China and the
Yeah.
training was kind of hardcore. But I heard like
Yes.
in Russia, they are actually the Russian synchronized swimmer. They are actually the coaches are quite patient. Like even if you
Mm-hmm.
can't get the move and they have to stay there for another hour just to
Yeah.
get that move right. The
Yeah.
patient, the level of patience is very very good.
It's different.
And
Yeah.
if it's China coach, if you can't do it right, and then like
Yeah, it's because of their culture, because China
yeah,
has a
it's true,
lot
it's
of
true.
people. And so they have even backups. They have backups. If let's say one person can't do it or maybe get injured, there's many 10 more behind waiting to be at that spot. Where else
Yeah,
in
true.
Malaysia, there's not many people that in one spot, there's not many backup. So that's why
Yeah,
we cannot follow that way in
plus
a
our
sense.
sport is not very common, so it's
Yeah,
even hard to find backup at that
correct,
when we were
correct.
training.
Yeah.
So we have another question.
Okay.
Oh, from Dr. Teku. Hello, Dr. Teku. One
Hi, is
personal
that your
question.
lecturer?
Oh no no no. She
Oh, okay.
officiated our event.
Oh, hi. Sorry.
One personal question. Would you
Okay.
encourage your own children to participate in synchronized swimming after your own personal experience with injuries?
Um, Participate,
The
yes,
fear.
but I will let them if I have children, I will let them explore what they want. And let's say if they like synchronized swimming, I would support them. But at the same time, if let's say there's a minor issue like injury and stuff like that, I would try and spot it quickly. I'll try my best and spot it quickly and encourage her or him to recover. As last time, sports science recovery wasn't a big thing at my age, so I didn't have the time or a background to say, okay, once I have this injury, I need to treat it, or maybe I should. What's the next step? But since I know better now, I would encourage them or maybe teach them recovery is a very important thing in sports, especially in synchro, because you need to maintain your flexibility and also your agileness. Yeah. But if let's say my kids don't like synchronized swimming, I wouldn't mind either. I just want to
Someday
the
you see, you see a mini you, but I think it's fun.
and I will say, no,
And then you
it's
see
not fun.
flashbacks, flashbacks to like 20 years ago when you were swimming,
Yeah.
when you were four, uh, and then it's like yeah, it and then you actually mentioned him. people think like since we're both talking, right, we're both girls, and then I mentioned
Oh,
artistic swimming. People really think
okay.
like it's maybe just a girls sport, but there's actually
Mm-hmm.
guys in the sport.
Yeah, it's develop synchronized swimming is developing. Yeah, so
Yeah,
soon you'll see guys, soon, very 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 soon you'll see guys and girls swimming together, which is a nice thing
there's
to see.
already there's already few in training
Yeah,
like
yeah.
the guy swimmers.
Mm-hmm.
So
Even world champions, they are guys.
yeah, exactly. And
Alexander,
then
yeah, yeah.
the guy's legs are even more beautiful than mine. I'm jealous.
Better than mine too.
Yeah. So maybe we can close it off with one more question from me.
Sure.
So we talked about your injury. We talked about we even talked about synchronized swimming, for that matter, and
Mm-hmm.
we talked about your mental, like not your
Mental
mental.
health.
Sorry, we talked
It's
about
okay.
how do you deal with your stress and all. So
Mm-hmm.
like does it ever affect your like how do you feel during like tournament, your stress level before your performance and after your performance, how does the emotion develop?
Mm, okay. Lucky enough, I don't get jitters. You know, jitters. Some people get adrenaline, then some will want to go toilet, and some probably like, I don't know, they have jitters before a big event or stuff like that. Luckily, I do not have that. But I do sometimes have it, but I will try to suppress it so that it doesn't affect my performance. Um, because in artistic swimming, we need to follow. We have trained so hard just to follow the be in sync with the music. So if you have an adrenaline pump in you, you want to move. Everything will be moving very fast. You want to move as fast as you can, stuff like that. So in my sport, you need to kind of lower it, suppress it down so that you can perform as well as when you train in a way. So at that time, I would try myself to suppress that feeling and just listen to the music and dance, kind of like dance my heart
Yeah,
out
that's
from that. Yeah. So after my event, if let's say I did well, I think personally you would know whether you done well or not after your swim. As an athlete, you should have that lah because you should know your body well, whether did you perform or not. And throughout the years, after so many years, by the time that maybe after 10, 15 years, you can feel it, whether you did well or not. Even though you can't, but I think your coaches, your teammates will tell you, oh, you did well. And other people also might say, oh, you did well and stuff like that. That give you
yeah,
um, a stress relief in a way. So from there on, after competition, you would feel more lega. Is it called lega? Yeah. You feel like, oh, okay, I did
relax.
well. Yeah. So
But
that's
sometimes
how.
sometimes when you like if I was in a team event, so there were like 8 people, and
Mm-hmm.
if I were to ever like perform in any way that actually I know for sure affected the performance, and then my
Mm-hmm.
after
Okay.
performance
That's different.
attitude will be like
Yeah.
really really down.
That's the difference between an individual sport and a team sport. So team sports builds you team spirit, and that's a good thing in a way because you're aware that your mistakes or maybe your a little bit of carelessness might affect the team. It's a good thing that you feel sad, but there's always a future competition that you can do better and stuff like that. Yeah.
But you're actually also a team. You're actually also a team,
Yeah.
right, with Huawei. So
Yeah.
it's duet is actually also like kind of a team effort.
Yes, yes, agreed. So, if let's say, how do I say, you will have throughout the years of training, you will have a team member, or in the case you have 8 team members that have the same goal, which is to do well in competition. So, I think it's a good thing that everyone has the same mindset. Everyone has the same
I
goal.
think it's
So
important that everyone actually has the same mindset during tournaments.
yes, yes. With the same mindset and same goal, I think it will build your confidence and your team's confidence in a very drastic way.
So I
Okay.
think that is all the time we get
Okay.
from from the session with you. And I heard you're getting your booster today, right?
Yeah, I'm going to go
Yeah.
soon.
so thank you, Zidane, for joining
Thank,
me and joining us for this session. It was very insightful, and
thank you.
thank you for sharing your experience. And it was nice talking to you again after so many years.
You can contact me anytime you want.
Okay. Okay.
Okay.
So I'll see you when I see you.
Okay, sure
Okay.
thing.
Okay. Bye.
Bye.
So next I'm gonna pass it on to um, pass it on back to MC. So thank you, everyone.
Thank you to our moderator Chai Jia Yi and Miss Zilin Lee Ying Hui. It was such an informative sharing from Miss Zilin. It was interesting to hear real life experiences from our own national athlete. We can see how challenging and difficult it is to represent our own country in sports. Thank you once again. We will now be giving out a Google Form link for the attendance and feedback form in the comment section. Please fill in the forms accordingly. We appreciate your comments and feedback in order to better our quality of service to you. Thank you for your cooperation. Next, excuse me. Next, let's welcome our next speaker, Dr. Rosanna Dev Omar Dev. First of all, please allow me to introduce Dr. Rosanna, Dr. Rosanna. Dr. Rosanna Dev Omar Dev was born in Georgetown, Penang, Malaysia. She pursued her first degree in actuarial science and dance at the University of Nebraska, Lincoln. She later obtained her Master of Physical Education at the same university in the field of exercise physiology and nutrition. Dr. Rosanna Dev completed her doctoral degree from University Putra Malaysia in health psychology in 2018. She is also a certified American Council on Exercise ACE, personal trainer and aerobics and Fitness Association of America AFA group aerobics instructor. She is an environmental activist who promotes sustainable living. She had published and presented many papers in various conferences worldwide during her career as a lecturer in University Putra Malaysia. Without further ado, let's give a warm welcome to Dr. Rosanna Dev Omar Dev. Please welcome.
Assalamualaikum warahmatullahi wabarakatuh and very good morning. Everyone can hear me?
Yeah, I can hear you, Doctor.
Okay, Alhamdulillah. Okay, alright. Yang berusaha Associate Professor Dr. Tengku Fadila, Tengku Kamaldin, the Head Department of Sports Studies for the Faculty of Educational Studies, Mr. Wan Zaharuddin, yang berusaha Mr. Wan Zaharuddin Wan Abdullah. I think that's the pengarah, I think, program, yeah. The first panelist for today, Dr. Johan Abu Kahar, and our panelist who had just presented hers just now, an athlete, Miss Zailaine Lee Ying Hui, yeah. And everyone, the audience that we have today so far, how many so far? Hopefully many that can benefit for our session today. Alhamdulillah. I actually invited most of my postgrad students, my undergrad students, come, join. All right. So let's start with the topic that was given to me today, which is on psychological sports injuries psychologically, right? And I will touch on psychology factors on athlete stress, all right? Can we have the screen, please? Okay, the slides are on the way. That's fine. Before we start, yes, my area for my PhD, I did my thesis on health behavior. on health psychology, health behaviors under health psychology. I'm more on interested in general population in terms of why certain people behave in such way in exercise, more in that way. I did quite a lot as well in the States in sports psychology and exercise psychology, but not anymore now. I'm more interested in general population because most of our population in Malaysia are not athletes, but they are actually recreational athletes, not high performance athletes, but they are kind of novice athletes, recreational athletes, and we do have an increase in recreational athletes. Yeah, so it is very important that everyone do take care of their health, not just physically but also mentally as well. Okay, why I say that, because those who actually, if you observe around, every weekend you see a lot of cyclists, right, on the roads, on our main roads, on our highways, cyclists, yeah, and we all those are recreational athletes, and we also see many hikers, yeah, going during the weekends, spending 4 to 5 hours set on Saturday, and the next 5 or 6 hours or so on Sunday as well. So they do that every weekend. So those are recreational athletes, and we have many of those coming up, increase of numbers, yeah, in Malaysia. Not just that, we have long distance runners going in for Standard Chartered run, Hong Kong run, yeah, things like that. So many recreational athletes coming up in different sports. So and injuries are prone to happen. Okay, are the slides ready? Okay. All right. Okay. So yeah, that's me. I'm Roxana Dev Omar Dev. I'm in from the Department of Sports Studies. I teach a lot of health classes for my department. More of and also train as a nutritionist. When I did a lot of nutrition in when I was in the States for my master's. But I focus more now in psychology. All right. Okay. So let's start. Inshallah. Bismillah. All right. Okay. So our topic today would be on athletic injuries in psychology. All right. So and our outline for today would be we'll look on common injuries in Malaysia, role of psychological antecedents to athletic injuries, stretching injury relationship to that, and psychological reactions to injuries. We will also see some signs of adjustment to injury. And last but not least, we will actually will discuss a little bit on strategies to speed up rehab. Okay, next please. Okay, a little bit of background statistics. This is actually in 2017, where I'm not sure whether Dr. Johar have actually showed this or not, but this actually taken from one of the articles back in 2017. A total of 2,787 injuries actually being recorded, average of 0.6 injuries per athletes per year. All right, so that is actually being in the one of the conference being given, and being notified that sprains and strains are most of the injury being complained by the athletes, and knee are the common site. It is the most common site where injury occur. And most injuries occur not during the competition itself, but during training. All right. And of course, we know that physical factors are the primary cause of injury, but more and more psychological factors contribute for injuries as well. All right. Next. So what does pulut? What is this? Pulut panggang, right? Pulut panggang, and what's the other one? Anyone knows? Anyone know what? Don't go in. The one on your right is pulut panggang. What is pulut panggang? Pulut panggang is actually a delicacy in Malaysia, quite famous, more from the northern states. Maybe you can find also in the Klang Valley and things like that. What's in the filling that makes it delicious, which is this is a shrimp paste kind of thing, and it's being grilled, being grilled and then wrapped by with banana leaves. But the one beside it, it looks like sama tapi tak serupa, right? It looks as though like pulut panggang, yeah. But it's from the eastern states. Who knows what pulut is that? It's not pulut panggang, but I'm married to Terengganu, so the filling that differs from the pulut panggang, which is on the right, the one on the left is the filling is actually fish. Okay, so of course those people from Terengganu and Kelantan, they eat more fish because they are in the eastern side of the peninsula Malaysia, and it's more coastal kind of, right? So why are we talking about food today? It is actually because food can give you stress, promote stress, and also relieve stress. So as sport, yeah. We know when we exercise, it gives out endorphins, it gives good neurotransmitters, serotonin, dopamine, all that, which are cheerful neurotransmitters that helps in our psychological benefits, yeah, especially. But at the same time, it also can promote injuries as well. Okay, so so we are looking at two factors, psychological factors. Yeah, so that's what we're gonna do today. All right, next. Okay, so other common injuries in Malaysia, besides the strain and sprain that we have mentioned just now, we have also injuries like hamstring injuries, ankle sprain. Dr. Johan must have given this to you just now. Knee injuries, plantar fasciitis, which is because of the arch, yeah, shoulder impingement, tennis elbow, fractures. So those are all the common injuries that we have in Malaysia. Next, please. However, the rate of injury, that we have, it's quite different, men and women. Probably in data given in 2017, 358.2 versus 247.04 injuries for every 1,000 hours being on the field in terms of match. Yeah. So, so this is actually one of the most injuries happen in the type of sport. Yeah. So this study was actually done comparing futsal and football. So futsal recorded high injuries in accordance to 1,000 match hours rather than when they compared it with football. Yeah. And also, besides the muscle strain, muscle pain that we have mentioned just now, and because of the test, well, there are also number of injuries are also among highest in sport like badminton players, followed by hockey and rugby, and higher incident are among the men and women, among men compared to women in hockey players. And if we compare with individual sports and team sports, athletes in individual events had higher proportion of severe injury compared to those in the team events. Okay, so that is kind of the statistics that we have in terms of injury in Malaysia. So in other words, the more hours you spent actively in sports, you kind of increase your rate of injury, right? Yeah. So another one that I would like to actually mention here is the functional training CrossFit. Right now, lately, it's been quite famous. Yeah, in fitness centers, we actually have 50 to 70 of that programs here in Malaysia, and 46% of that injury are because of that type of training. So what is functional training CrossFit? It's actually a combination of weight training, and some regime that they have in the gym. So that we do see a lot of data out from the States and also in the UK and out in the some of the European countries, but we do not have so much data from Malaysia. There's one that came out in 2020. So that is the data. That's the rate, the rate that I have, which is 46% of injury from that regime. Next. Okay, so this is another slide that I would like to show on the type of sport based on the injury and the type of sport as well. The injury incidence rate according to the type of sport. So soccer injury per player per 1,000 hours about 5.1, badminton 2.9, bodybuilding 1.0, gymnastic 1.6, Highland Games 7.5, professional football 8. So this is actually data from abroad, not from Malaysia. The one that we have in Malaysia are the ones actually later on that I will share later on. Next. Okay, so this is also some data that I have, but this is not per 1,000 hours, but this is just a general rate in percentage. So we have CrossFit from the UK, 19%. I think that is from Finland, 74%. And then another CrossFit data is 56.1, another CrossFit data, 31%. And then we have data for long distance running, about 20 to 79% from injury rate, soccer on artificial turf, 56%, and martial arts and combat sports, 53.6%. All right, next please. So with that, we have looked at all those data, and in Malaysia as well, the one that I've mentioned earlier on, we do have some data, but we have to get more data, in terms of injury, and more should be also emphasized on some psychological factors as well. Okay, and the one that we have here, the slide that you have in front of you, is a very famous slide on the role of psychological factors in athletic and exercise injuries. We know that physical factors are the primary cause of athletic, I've mentioned earlier on athletic injuries. But psychological factors also contribute to that as well. And also recent evidence have shown that psychological factors also play a key role in injury rehabilitation. Okay, thus fitness professional like those who are in sport should actually understand both psychological reaction to injuries and the way in which mental strategies can facilitate recovery. All right. So in fact, in few studies we have done from 2006 to 2017, 90% of sports medicine physician that actually relate with sports, discuss emotional and behavior problems related to injury with patient athletes. Besides their physical problems, they do complain, and they also discuss on their psychological problems as well. So this physician most often discuss the psychological issues of stress, or in terms of the pressure, the anxiety, and burnout with their patients. Because when they are injury, they are scared. They will kind of have this security whether they can play again or not, whether they be able to play like before. That's a huge impact in their life. So the model by Williams and Anderson, which is actually what the model that you have on the slide right now, would actually help clarify the psychological factors play in athletic injuries. Okay, so if you can see from this model, the relation between athletic injuries and psychological factors centers on stress. If you look on here, it centers on stress. So in particular, a potential stressful athletic situation, for example, probably like competition, that would be a stress. Important practice that would actually involve in getting him to be selected, and that would be a stress factor. Or something like a poor performance, that will be a stress. Yeah, so this would actually contribute to injury. Yeah, so that depends on the athlete, depending on how the athlete perceive and how threatening he perceive the situation to be. Yeah, so if you look up closely, that is actually what the model says. So a situation perceived as threatening, if the situation perceived as threatening, so this will increase your state anxiety. Yeah, anxiety have state and trait anxiety. Okay, if you want to know more about that, you have to take psychology, sports psychology. So we have actually anxiety, we have trait, we have state anxiety. So which causes a variety of changes in focus or tension and muscle tension. Yeah, so this would actually what I mean by muscle tension would be distraction or tightening up or something like that. Sometimes it will give that somatic symptoms. Yeah, so this will actually lead to increased chance of injury. Yeah, increased chance of injury. So stress isn't the only psychological factor that influence athletic injuries. However, if you look at that figure itself from that model, yeah, personal factors, personality, history of stresses, and coping resources all actually influence the stress process. Yeah, so that in turn will actually promote injury. Okay, so furthermore, after someone sustains an injury, these same factors influence how much stress the injury causes, and the individual subsequently rehab and recover. So in other words, to sum up, there's so many factors that influence the injury in psychology. We call it as psychosocial factors. Yeah, so so it means that those like athletes, or don't care whether you are high performance athletes or recreational athletes, novice or things like that, people who develop psychology skills along the way when they are in sports, when they are involved in sports, like goal setting, like what our friend just now mentioned on goal setting, imagery, or any relaxation techniques, would actually deal better with stress and would reduce their chances of being injured, and also the stress of injury could that should occur. So it worked both ways. Okay, it worked both ways. So and also from studies, it has also been suggested that the stress athletic injury model can be extended to explain not only physical injuries but also physical illness. Okay, injury, that means what we have just now, we have sprain, the strain, and things like that, but also physical illness that may result in terms of combination of intense physical training and psychosocial variables. So what this physical illness is, like, your upper respiratory symptoms illness, your flu, your cough, and things like that, your fever. So those are physical illness as well that actually interrupts with your performance, right? So that also includes, yeah. So thus, this model may be useful in explaining why the athletes develop infections in such a way that I would say it, and poor adaptation to training and physical complaints when highly stressed. All right, hopefully that helps. So with this overview of the roles that psychological factors can play in athletic and exercise-related injuries, then probably with the next few other slides, we can actually examine in more depth in terms of the pieces of the model. All right. Okay with me so far? Inshallah. All right, so next. All right, so as you from the model, so now we are picking pieces from the model, okay? So how injuries happen, as mentioned just now, one is personality. So physical factors such as we know that to before we start from personality, physical factors such as muscle imbalance, high speed, collision, overtraining, physical fatigue are the primary causes of exercise for sport injuries. And we want to mention today is on the first one in the model is first personality factors. So personality traits actually among the first psychological factors to be associated with athletic injuries. Yeah. So we actually probably to date personality factors associated with athlete injuries have not actually give a great sum up on to identify the reason, the full reason for it. However, athletes with low self-concepts, have uh, actually do have some higher rates of injury. All right. So, for example, probably those with higher lower self-concept have higher injury rates than their counterparts. Yeah. But unfortunately, this research on personality and injury has actually have some inconsistency I mentioned earlier on. But I would like to actually also touch a few that probably there is one on 2017, 2018 that touch on some personality that might give some interest, where optimism, self-esteem, hardiness, and trait anxiety probably can help in terms of athletic injuries that can reduce or reduce athletic injuries. However, more studies should be looked at. Yeah, more studies should be done. Yeah, more being said by psychologists or by sports psychologists is that personality factors are more complex, where they think that it tend to be more as a moderate factor for the relationship between stress and injury relationship. What I mean by moderate factor, it actually influence on the strength and also the direction of the relationship. Okay, so what I would say that if a person with which we characterize by a high trait anxiety, the stress injury relationship may be stronger than a person who is low trait anxious. Yeah, so that is somewhat probably those who like to go into that can look into that. Yeah, who like to actually do PhD or masters in that kind of topic can look into that more. Yeah, so that is on personality. Next, please. All right, so yeah, I've mentioned this, I guess. Okay, next. Okay, so next one is actually on stress. So stress or stress or history of stresses. Yeah, people with high level of life stress, um, um, how would I say this? People with high level of life stress have more sport and exercise related injuries. Yeah. So when I say life stress, meaning all type of stress, actually how we perceive the stress is another factor by Lazarus. Yeah. So and also how we cope. Yeah. So losing loved ones is a stress for someone. Most of us. Getting married can be a stressful event as well, even though it's a positive kind of thing, but it can be a stressful event as well. Having problems finance is it's a stress factor. Yeah, so those are actually antecedents, important antecedents that can be identified that promote athletic injuries. Yeah, so so that would actually be a thing that people would want to look at. Yeah. Another one is coping resources that would be important as well. Yeah. So Smith and colleagues found that in terms of life stress related to injuries only in at-risk athletes, because these athletes, we term them as at-risk athletes because they have really few or really low skills in coping skills and low social support. So they are at-risk athletes because when they have stress coming in, they won't be able to cope. Okay, so this, it is not just athletes, it's everywhere, right? It's bound to happen to anyone. We are stress is spices in our life. Okay, we have stress every now and then. Every day we have stress. Yeah, it can be from one issue to another and things like that. But the most important thing that we have to look at is how we cope with those stresses, how we perceive those stress. Okay, so yeah, so that's another thing that important in the model, right? Okay, next. So with that, the next thing is we also need to look at is to explain on the in terms of let me see, hold on. Explaining the stress injury relationship. Okay, so what? So understanding why athletes who experience high stress in life are more prone to injury can actually significantly help us to design, how would I say, effective sports medicine programs to deal with stress reactions, yeah, and injury prevention. So two major theories have been advanced to explain this. So to explain the stress injury relationship. So the two theories are actually based on the first one in the model itself is attentional disruption. So when stress actually disrupts an athlete's attention, yeah, it will actually reduce peripheral attention and cause distraction and task irrelevant thoughts. So let's say, for example, if you are not focused. So if you have some disruption on your attention, so that means you're not focused. Your concentration is actually jeopardized. So that will promote injury. Yeah, that will promote injury. So if you're not 100% focused on what you should do and things like that, and you, even though you have your imagery technique and all that, but you're not focused, down you go. Right? So attentional disruption, that is number one. Number two is increased muscle tension. So high stress can also cause muscle tension and coordination interference. Okay, so so when you are not focused, then other things would actually come as well. Yeah. So for example, highly stressed gymnasts, okay, might experience more muscle tension and things like that. That is desirable and fall from a balance beam. Yeah. A gymnast who is actually going to perform a routine on a balance beam with disrupted attentional, so not focused, so increased muscle tension, the gymnast is bound to fall. Okay, he won't or she won't be able to complete the routine on the balance beam. Okay, so this is one two theories to explain the stress injury relationship. So when you fall and things like that, you are bound for injuries. Okay, so that is why teachers and coaches who work with these athletes need to have a stress management kind of thing, where they can actually, when they have this, when they anxious or they are not focused, when they are stressed, they know what to do. They know what to do. Okay, next. Okay, other stress injury relationship are the overemphasis on acting tough and giving 110% attitude. From where? From who? From the coaches. Yeah, usually give 110%. What does that mean? Give 200%. What does that mean? Okay, you can give 100%. You're giving more than what you can, you know. You hear that so very often, right? So what does an athlete perceive when coaches say that? So, and you always hear that no pain no gain, duh, you know. So what does that mean? So you need to feel the pain to win, right? No hard or go home, go hard or go home, go for the burn, and then not unnecessarily encourage athletes to play hurt or take undue risks. So this will actually promote injuries. So all these factors, all these unnecessary remarks and factors are given by the coaches themselves. If you realize that, yeah. So they're pushing really hard. Of course, you want to give your best, but when you do things like that, they will be, they feel reluctant to, you know, somewhat they have to give their really best, even though they are injured. So that's not good. If you are really injured, you're not supposed to play. If you're injured, you're not supposed to play. You can actually make the injury worsen the injury. Yeah. So so that is actually a serious matter. Yeah, a serious matter. And another thing is failure to distinguish between normal discomfort and injury pain. Yeah. So athletes need to identify when he or she can play and when he or she cannot play. All right. He needs to or she needs to identify when you're injured, and sometimes the coach will say you're worthless attitude. So that's, you know, that's not good. That's not good. Sometimes what they are giving to the athletes as the winning is more important than the athletes' well-being. Is that right? I don't think that's the message. The message, or that's the intention. What the coaches should be giving to all athletes. Yeah. All right. Okay. Next. Okay, physiological components of athletic injury stress. When we are stressed, physiologically, there are actually something happening in our body. Yeah, sympathetic things that happening in our body when fight or flight response when we are stressed. Yeah, so it increases catecholamines and also glucocorticoids, which actually impair the movement of healing immune cells. Okay, so it impair these healing immune cells to the site of injury and interfere with the removal of damaged tissue. Okay, so in other words, when we are injured, that's why we need to rest. We are not supposed to play. We won't be able to have our immune system to work at its best when we disturb that process. All right. So prolonged stress may also decrease the actions of insulin-like growth hormones. They are critical during the rebuilding process. So athletes, coaches, all that, all above, need to know all this. Okay. And stress also causes sleep disturbance, which also another factor that identify as interfering with physiological recovery as well. So we need to have that being taken care as well. Good rehab practice. So no more play. Well, you can do your physiotherapy during your rehab, okay, but you cannot go for training. Okay, cannot go for training, and and when you're injured, that's it. You have to rest. Okay, right, and then you have to have enough sleep. Nutrition wise, you need to have enough good food, right? Good protein. You need to have complete protein. We have incomplete and complete protein, and most of the complete protein comes from the animal sources. You know that, right? So yeah, when you are injured, you need to have complete protein. The only plant source that you can have complete protein, near to complete protein from animal source, is from where? From your soya, from your soy. Okay, but others from plant is incomplete protein. Okay, all right. Okay, next. Okay, so the three general categories of emotional reactions to being injured. So one is injury relevant information processing. Yeah. So the injured athlete focus on information related to what? To pain of injury, and they are aware about how much extent of their injury, and question about how the injury happened, and the individual will actually recognize the negative consequence or the inconvenience. So these are the general categories of emotional reaction to being injured. So that's the first, how the athlete would actually check on that. Yeah. Number two, another emotional reaction when they are injured is emotional upheaval and reactive behaviors. So once the athlete realizes that he or she is injured, he or she would be actually emotionally agitated, so involved, experience vacillate the emotions, and then feel hopeless, emotionally depleted, experience isolation, because people say, okay, we'll see you in 3 weeks time, or not 3 weeks time, 3 months time, and they just leave the athlete just like that to recuperate. But that's not it. That's not good, right? Disconnected from the team members, even the coaches doesn't really say hi or things like that, in disbelief, feel still in shock, or a denial, or self-pity, things like that. So these are reactions that needs to be taken care of, and because it's a sudden kind of thing, right? Even though the athletes take care of how their practices and things like that, injury, we cannot actually stop from happening. Injuries can happen even though we are careful. It bound to happen. uh, even though it's not a contact sport, it bound to happen when we involve in physical activity or sports. Okay. So and also another thing is positive outlook and coping. So the athlete accepts, when they accept the injury and deals with it, so the step will come in to initiate positive coping, in terms has exhibit a good attitude, and be more optimistic, and to actually to monitor their progress with their physical therapists and things like that. In reaction to injury, most athletes move through these general patterns, yeah, but the speed and the ease with which they progress actually vary widely. It depends on how it varies, depends on the social support, how much they get from the rehab, the physical therapy sessions per week. One might actually be ready to go, or heal in a few weeks, months, or others can be in months, or it depends how severe the injury and things like that. So the period, actually, it depends, yeah. But it has to actually have this a gradual momentum, so that they have this great feeling as it goes on, so they know that they are actually at the right track. Yeah. All right. Okay, next. Okay, so the keys here, most people experience a typical response to injury, but the speed and ease that I've mentioned just now, with which they progress through stages, can actually vary widely. So the period immediately following injury is characterized by the greatest negative emotional reactions. That would actually would be the initial stage. But once they are with the routine, a good system made for them, they'll be okay. Right? They'll be okay. All right, next. Okay, so athletes actually experience additional psychological reactions to injury. Okay, so these are some of the other reactions that I would like to share. There are four other injury reactions. One is identity loss. Few of the athletes who cannot longer participate in tournaments or things like that, in competition, because of the injury that they experience, they kind of lost their personal identity somewhat, yeah. So that is an important part of themselves that's lost, because when they are an athlete, it gives them their self-esteem, self-confidence, self-concept. Okay, so this injury would actually give this short-term identity loss, all right? Short-term identity loss. So this is a psychological injury reaction, all right? Next one, next please, is fear and anxiety. So when injured, many athletes would actually experience high level of fear and anxiety. They worry whether they will recover, yeah, especially if they when they will recover. They will actually fear.
Sorry on behalf of Dr. Rozana. I think there's a technical issue on Dr. Rozana internet. Yeah, it's no problem. Please be patient while we wait for Dr. Rozana to come back. For the audience, please be patient while we wait for Dr. Rozana to come back, and don't forget to fill in your uh, your attendance at the comment section.
Okay, sorry about that. MashaAllah. Internet interruption on the internet. MashaAllah.
Yeah,
Sorry about
it's
that.
okay, Doctor. You can continue.
Okay, all right. Where was I? I was on the fear and anxiety kind of thing, right? Okay, sorry about that. Allahu Akbar. Okay, okay. This happens when you're at home with the internet. Yeah. Okay. All right. Let's start again. So that's the stress factor. But nope, I can cope it. All right. Okay. Let's do this. Fear and anxiety. Yeah. So when someone's injured, so they worry whether they will recover, if injury will recur, and whether someone will replace them permanently in the lineup. So that is very stressful, right? Let's say you are a star, and sometime suddenly you're not a star anymore. So that's the fear that they have. Yeah. Because they cannot practice and they won't be able to compete, and there's so many people waiting for your place, right? Yeah, so because you can't do anything, you tend to worry. So that's another reaction that really happens most of the time. That happens usually most of the time. Okay, next please. Lack of confidence. So giving the inability to practice and compete, and they are deteriorated in terms of their physical status. You know, when you don't exercise in a week and things like that, reverse. Yeah, so you will tend to lose your muscle mass and things like that. So you're not in shape anymore. But that's never mind. It's okay. It happens. Like say for example, anyone is like that. If you don't when you need to exercise in order to be fit, right? You need to exercise consistently in order to be fit. But if you let's say for example you do a little bit of exercise physiology, all right? so so let's say for example you're an avid exercise person, all right? So you exercise every day at least 40 minutes a week for cardiovascularly, so aerobics, yeah. So you do aerobics 3 times a week of strength training. So yeah, you're okay. So aerobically 7 times a day, 7 times a week. So you probably do some aerobics or something like that. So you are fit. But let's say you are injured, so you are not able. You have your leg cast, yeah. So you're not able to walk around and things like that. So you're not bedridden, but you cannot, yeah, you cannot go for your jog anymore and things like that. You need to rest. So you are out from the from your normal exercise for a month. Huh? So within that 1 month, what you have gained on your fitness, it will actually you will lose for that one whole month. You will lose all those fitness status that you have earlier on, but that's okay. It's okay, but it's just that you will because fitness is reversible. So you can once you're okay, you work it. You can work it back. You can work it back. So no problem. But when you are in sport performance kind of thing, or maybe high performance, you have many candidates coming in eyeing on that position, then that will be a problem. Yeah. Because other people will come and replace you. So that's why your fear of that, then your lack of confidence. So when lowered confidence can result in decreased motivation. Yeah. So it is will interfere with performance or additional injury. Because of that, you cannot actually be healed faster. Because of that feeling of the psychological factors will actually prolong your healing process. Yeah. And this will actually give effect on your rehab and healing process. Yeah. Okay, next. And performance decrements. So performance decrements are because of the lowered confidence and missed practice time. Athletes may experience post-injury performance decline. So this happens almost immediately, and many athletes who have difficulty lowering expectation of an injury expect to immediately return to a pre-injury level of performance. So you will not get until to that point. Yeah. So you need to work hard. You need to work really you have to work, and then work more from because you have just injured, so you have to work yourself up again so that to be at that level before you are injured. Okay. So yeah, so there will be a performance decrements. Yeah. Okay. All right. Next please. What time do I have? 12. I will stop at 12:05 or something like that to get questions. Yeah. All right. So signs of poor adjustments to athletic injuries. Your feelings of anger and confusion is one. So that's signs. Yeah. Signs of poor adjustment to injuries. Yeah. So you feel anger. You feel angry. Of course, you feel angry because you cannot play. Yeah. If you have if it's just a day or two, it won't matter as much. But your injury might take months and weeks and months. So that will make you angry, confused, miserable. Yeah. So those are the signs if of poor adjustment. Okay. Number two signs is obsession with the question of when one can return to play. When can I play? When I can play? Every time you go to see the physician to check on your injury, when can I play? That's the answer that you've been asking, and it's to you have to actually make sure that you are properly healed. Then just interested to know when you can play. Yeah. Denial, the injury is no big deal. You always say, oh, no big deal, I can go up in any time, no big deal. Well, you can say that, but you need to look at it individually. Though you need to look how is the injury is on you, and then so that you are focused for it to recover. So that's the important thing. When you say no big deal, sometimes you kind of slack on the in recovery process. So you don't go to the rehab, you don't go for the physical therapy, because you say no big deal, I can do it on my own. So that's the denial. That's denial. Okay. And then repeated coming back too soon and experience an injury. Sometimes you're so bored in your room, you will go to practice and you tend to do some training. So that's not good. You're not fully recovered and you do some training. So this injury will reoccur. Yeah. And then exaggerated bragging about accomplishment. You will actually brag about your previous accomplishment and things like that. Yeah, because you want to. That is actually normal. But if you overdo it, it is actually a sign of poor adjustment. Poor adjustment. Next. Dwelling on minor physical complaints. So that would probably usually when you are injured, yeah, there are sometimes you would want to you do tend to complain on this is painful and things like that. But usually it will the pain would gradually be better. You will be able to cope with the pain with time. But if you actually don't do that, I mean, you're not having that recovery process as it is, probably you are actually exaggerating more on your complaints or on your pain, then probably that's also a sign of poor adjustment. Okay. Maybe you want some attention, you're not getting more attention that you should. Maybe you want to get some attention, things like that. All right. Guilt about letting the team down. So that is another sign of poor adjustment as well. You always apologize, sorry, and things like that. So that's another sign of poor adjustment. Withdrawal from significant others. So you withdraw completely from your friends, you withdraw completely from your teammates. So that's another sign of poor adjustment, because you feel your self-concept has reduced, your esteem has reduced, or things like that. You don't want people to see you with a cast or things like that. So that is sign of poor adjustment. Rapid mood swings. Sometimes you feel good, sometimes you're up and down, so it fluctuates. So that's also another symptom of poor adjustment. Okay. Statements indicating that no matter what is done, recovery will not occur. So that is another sign. You're not taking it positive. You're always negative all the time. So that is not a good thing that you have in mind. You always want to think positive, but in a moderate kind of manner, so that you take it into process of the situation. Yeah, of the situation. Okay. All right. Next, please. Okay, so when abnormal emotional, in terms of poor adjustment to injury, it means that you will actually need some professional help. So all the signs that I've mentioned just now, then you need to get help from people. Yeah, referral to sports psychologists or some mental health provider. would be needed. Okay, because it might lead to depression, severe generalized anxiety, or somewhat like that. So it has to be looked at. Okay, so your coach or your friends, your teammates, if you see these type of cases with your mates who are injured, then probably you want to take note and probably advise him or her, or advise to someone else to take the injured person to be looked at or something like that. All right. Okay, next. So the keys here, the holistic approach is needed, yeah, emphasizing healing of both mind and body. So that's very important. We have heard of mind over matter, right? There are some books. This is important, actually famous years back, but even though it's mind over matter, but there are it has to be looked at in a broad manner. Cannot somehow you have to look it in a broad manner. And then psychological factors play an important role in injury recovery. We have mentioned that just now. Injury treatment should include psychological techniques to enhance the healing and recovery process. Yeah, and athletes will not automatically transfer psychological skills used in athletics, such as imagery, to the injury rehab situation. So it will be best if they can, actually there are some studies that have looked at when someone is injured, when an athlete is injured, when they look at imagery, when they use imagery techniques in their rehab practice, in their rehab process, the recovery time is less. So that means they recover faster. Yeah. So you can look at those. There are few studies that have looked at as well. Yeah. Next, please. I think that's only a few more. Okay, so using relaxation imagery during rehab reduce anxiety, yeah, associated with greater knee strength in athletes after knee surgery. Yeah, I've actually counted with a surgery, knee surgery, because of ACL. That I had to be reconstructed on my ACL because I due to sport injury many years back, not many years back, 5 years ago. Till now, my left knee is, I can't really straighten it out really well. But it's okay. But I can play though. I can do many sports though. That's good enough. But yeah, it's kind of frustrating because you used to do many things. You can do, you're flexible before, but now you are less, things like that because of the injury. But you kind of accept on you try to do as much as you can through your rehab, and probably your during your physical therapy and things like that. Yeah. So and then psychological factors such as self-talk, goal setting, self-motivation also actually give positive effect on adherence to injury treatment protocols. So take a look at all these techniques, yeah, that actually would affects on the treatment on injuries. Yeah. Next, please. So to understand the three-phase process of rehab and recovery, so you need to understand their injury or illness phase, the rehab and recovery phase, and return to full activity phase. So these are the phases that the athletes need to look at to actually program their rehab and recovery. Okay, so the injury or illness phase would actually help the athletes to deal with emotional upheaval and that accompanies on the onset of the injury. That's the first one just now. The rehab and recovery phase is actually help the athlete to sustain motivation and adherence to rehab protocols. Okay. And the third one is to full recovery is not complete until the athlete can actually return to normal functioning within his or her sport. So then that will be a full activity phase where you can actually go for full training and compete and things like that. Yeah. All right. Okay. Next. So this each phase actually have different approaches to the psychology of recovery. I don't think we have time to go for all those. Yeah. So with that, let's go to next, please. Next, we have done that one. And okay, so build rapport is actually important to get the social support. Educate the injured person about the injury and recovery process. That's very important as well. Next. Another role for in sports psychology for injury rehab is to teach specific coping skills, very important. So again, I've mentioned on goal setting, self-talk, positive self-talk, imagery, visualization, relaxation training. All this important to increase the recovery process and rehab. Yeah, and social support, very important. Social support. Okay, next. And this is a guideline to provide social support. So the social support can come from coaches, from your significant other, if you are married, your wife or your husband. If you're not, then your friends, your families, medical personnel. So those are all social support. So anyone that you can turn to. Yeah. All right. Next, please. So okay, next, I think this one we have. Okay, there is okay. Done this one. And the only thing, next thing is after the social support. If you don't get the social support, you need to accept and positively deal with the situation. Probably if you need to do it yourself, then you need to do it yourself and do it, in a gradual manner, so that the healing process and recovery process can take place. Yeah. So you need to set goals. Goal setting is very important. So let's say, for example, okay, this week, how much how much would you need to achieve? Next week, how much? So things like that would actually help with the rehab and recovery. Yeah. Okay. Next, please. Okay, this one. Okay, just now we have done this. Okay, next. Okay, so accept any questions. Okay, we have 12:10 right now. I can accept any questions if you have any.
Yeah, thank you so much, Doctor, for the sharing. We can see how important it is for us to have an understanding about athletic stress and how it greatly affects athletes' performance and fitness. Next, we will begin our Q&A session from the audience. The first question is come from Hong Yi Lee. Hello, doctor. I have heard before that psychological interventions and reduce the risk of injury in athletes. Is there any scientific evidence?
Yeah, sure. It works both ways. I mentioned this just now. With psychological intervention, it can reduce injuries as well, because when you have those concentration, just now I mentioned, we have actually gone through this slide where if you have proper attentional focus and things like that, you will not. For I gave you example of gymnastic just now, right? You would he or she would like to actually perform a routine on the balance beam. If you're not focused, you will actually fall. So if you have some psychological intervention like imagery, you have that, you're fully focused, then you will not fall. So the risk of injury is not there, right? Yeah, of course there is scientific evidence. Yeah.
We can move on to the next question from Adibah Faika. Can injuries cause excessive trauma to athletes that could affect them even after retiring?
Okay, all right. So it depends on how severe the injuries. Huh? So it depends on two things here: how severe the injury is, how the how the athlete perceive on the injury. Okay. There are some athletes who had to retire for good because of the injury, and because he won't be able to play anymore. You know, there are some players who are like that. That you won't be able to use your, you won't be able to do backhand, things like that. Then it is just, and then with the age that you are in, then probably it's best that you just leave the sport. Okay. So it's I cannot answer it yes or no like that, because there are so many factors to look at, right? But yeah, there are some trauma or some injuries that can affect even after retiring. Yeah, that's true. A fall, for example, can actually affect that. Yeah. Mm.
Okay, we move on to the next question from Matsibu. Which is better if the leg is sprained? Is it traditional massage, or taking medication such as painkillers and swelling subsides?
This is more questions for Dr. Johar just now. Okay, all right. For leg sprain, when you sprain your leg, probably you have to see if the leg, the part that it's being injured, there's any bruise, if it's swollen, all that first. Then you apply the ABC and things like that. But um, uh, if it's swollen, then you need to apply the ice. You cannot massage. No, no. Okay, so you have to look all that. Of course, when if the swelling is there, no massaging. No, no, no. All right. You need to have the swelling subsides first. Painkillers helps because you are such in pain. Yeah, you'll be in pain. Painkillers will help in terms of your pain. All right. But in terms of the injury itself, you need to make sure that it's not swollen, that of course it's no open cut or anything like that. Yeah. But then if it's sprained, it won't be a cut. If it's sprained, it's not swollen. That's important. So you have to ice it. And then if it's not, then after all that, then probably you can look into massage. Yeah, but not before that. The swelling has to go down and things like that before doing any massage, things like that. Yeah. The swelling have to go, and all that. Yeah, you have to apply the proper first aid first, the ABC and things like that before you can actually go for massage. Yeah, no, no. All right.
Okay, we move on to the next question from Marsita. Hello, doctor. Can you give some advice to the athletes who got injured and didn't have any encouragement to play sports anymore?
Okay, all right, Masita. Um, hmm. If you are injured, as I mentioned just now, it's very important that you have support. Yeah, you need to get support and feedbacks from people around you, especially your coach, your teammates, your whoever in your team. Yeah, that's very important so that you will have encourage for your self concept, your motivation for you to for rehab, to recover. That really helps. Yeah, because psychologically, it helps with your recovery process. It does. Okay, because our body is filled with chemicals. Yeah, we have neurotransmitters, we have hormones that helps with the physiological of you as well. Ya, your psychology akan membentuk physiology anda. Alright, so you need to have all that support in order to help in your rehab and also recovery process. So if you do not get that kind of support, I would advise you to get at least, if not get that kind of support from your team, then you probably get some support from your friends and families. You need to get that. That can help you to give that that feel of less of feel of anxiety, less of feeling all the feels that I said just now, of feeling of what identity loss, fear, anxiety, right? Lack of confidence. So how do you get that? The support from someone. So if you don't get it from your team, get it from someone else that you know of that can help you. Boleh? Yeah, Masita. Try, yeah? Try. Okay.
Okay.
But you probably now, I'm sorry, probably just now the question is maybe your family say, okay, don't play sports anymore because you're injured. That's another thing. All that depends on you now. Sometimes when you are injured, you feel that you don't want to be injured anymore, kan? Kita rasa takut. When you're injured, you have that fear that you might be injured again. Okay, that it will reoccur. So I would say that all depends on you. I would say how old your age. I want to know your age. Probably matters. Your age matters. What is your your goal in life? Yeah. What is it that you want? So you have to answer that. I can just give you all that next, there are some people, usually the family would say, okay, don't play anymore, you got injured already, or your spouse will say, don't, tak payahlah main-main lah. Or your boyfriend say, don't play anymore lah, we're going to get married. Why kan? Probably lah, I don't know. So it's all up to you. You're the one, okay? So I cannot answer that. Because if you're doing it for someone else, you won't do it. In performance pun, you tak akan perform betul-betul. Okay, you have to do it for you, right? You need to do it. You need to do it for yourself, not for someone else. Then you will do it really good. Yeah? Perform well and things like that. All right. Hopefully that helps.
Okay, Doctor. Thank you. I think that will be all the questions we have from the floor. Thank you once again, Dr. Rozana Dev, for the insightful sharing on athletic stress. We look forward to having you again in the future. Thank you, Doctor.
Inshallah. Thank you very much for inviting me, inshallah.
Okay.
Assalamualaikum.
Waalaikumsalam. Well, it looks like we have come to the end of the webinar. I would like to express my highest gratitude to our respectable and credible speakers and panelists, Dr. Johan Abdul Kahar, Dr. Rozana Dev Omar Dev, and Ms. Zilaine Lee Ying Hui. Our program advisor, Mr. Alias Abdul Aziz, Organizing Committee of Credited Co-Curricular Course QKS 2120, Volleyball Group 1, University Putra Malaysia. And last but not least, our participants for your wonderful presence and cooperation in today's webinar. I hope from this webinar, everyone can get a plenty of knowledge about sport injuries and athletic stress so that you can apply them in daily life, especially during sporting events. Before we end our webinar today, I would like to remind all participants once again to please fill in the attendance and feedback forms via link given. Lastly, we are very appreciative of your support, cooperation, and attendance today, and hope you receive a lot of benefits from this webinar. If there is an opportunity, I hope to see all of you in our next program. Have a good day, everyone. Assalamualaikum warahmatullahi wabarakatuh.